the world. This is a familiar shot now, the podium in front of Rideau Cottage, where the Prime Minister is about halfway through his own self-isolation after his wife, Sophie Gregoire Trudeau, tested positive for the virus. We're expecting him to speak to the country in about 15 minutes' time. Let's bring in now my two colleagues that have been helping me with these specials through the week. Power and Politics host Vashi Kapellas and CBC's David Cochran also joining me now. So a couple, I guess, bigger things happening today. Let's start with this medical supply chain issue, which we know is real, and the government is looking for ways to find people and industry and companies that can help them ramp up production of much needed supplies. I'll start with you, Vashi.
Yeah, that's right, Rosie, and that's my expectation as to the content of what we're going to hear primarily from the Prime Minister today. My understanding is that what he will say funnels through sort of the Ministry of Industry, or sort of the Department of Industry. And what they're going to talk about is that almost every industrial program they have will now be refocused on fighting COVID-19. So that supply chain that you mentioned, the level of preparedness, the equipment necessary in order to protect ourselves, and for healthcare workers, of course, most importantly, to protect themselves. All of that will be part of this announcement. They're going to try to gear existing programs like the National Research Centre, superclusters, the Innovation Fund, procurement, all of it is going to have to be refocused on this issue. They're also going to talk about perhaps the possibility of other firms retooling their existing manufacturing. I'm not sure as to exactly, which firms at this point. I think it'll be more of a general announcement today. But that is essentially the big announcement coming from the Prime Minister today. The second thing I'm told is that there will be something that we have already talked about that I think most Canadians expect, but a formal announcement from the Prime Minister that the border between the U.S. and Canada will officially enact those restrictions that we've been talking about, limiting it only to essential travel, non-essential, aka if you're going for travel or leisure. That will happen. That will come into effect as of midnight tonight.
Okay, David, maybe I'll pick up on that point with you, and that is the border, because that is the other significant shift that this country and the United States have made to try and contain the virus. And I would just note that they're also moving to do the same thing with their southern border between the U.S. and Mexico. But do we know more now about how practically this is going to work?
On the border shutdown, well, the way we're trying to figure out is who is going to be allowed to cross the border. The way we need to think about it is who won't be allowed to cross the border. That's the way this is going to be done. Essentially, a list of activities that are considered to be non-essential, and if you are one of those, which is going to be the vast majority of people watching this and listening to this, you're not going to be allowed to cross the border. So it comes into effect, I believe Vashi said at midnight tonight, or certainly into tomorrow. And if you are no tourism, no shopping, no random cross-bordering, there will be exemptions for healthcare workers. There will be exemptions, as the Deputy Prime Minister said yesterday, essentially keep on trucking. If you're a trucker, you're delivering supplies of goods, or, trains and these things, and people with critical visas. Core, essential cross-border work will continue to be done. But essentially, in some ways, Rosie, what's happening today is a shift from clamping down to ramping up. In that the industrial capacity of the country is going to be tilted towards making things like gowns, gloves, masks, face shields, ventilators, beds if they need it. You're already seeing, I don't want to call them extreme measures, but innovative measures being applied in places like Quebec, where they're asking for hotel space. 3,000 to 4,000 maybe hotel rooms, and hotels that can provide food and don't have carpets in the rooms, that are close to hospitals, where they can put people, not with COVID-19, but people who would be displaced by COVID-19 patients who need to have an eye kept on them, but maybe aren't in need of critical, urgent hospital care. And while we're going to see this announcement today from the Prime Minister and an explanation of the steps that they're taking, I want to make sure Canadians aren't left with the impression that there hasn't been a ramping up already going on. That has been happening. In fact, Dr. Theresa Tam, her entire job as the head of the Public Health Agency of Canada was created after SARS to allow for a national collective response and to build things like strategic critical stockpiles across the country. So they have surge capacity supplies already in place. They've been backstopping those with the things they need specifically for the COVID-19 outbreak for several weeks through the normal means of procurement and buying things. The step we're taking today, though, is is a reorienting of industrial capacity to support that entire national effort to contain this virus.
Right, because as people can well imagine, everyone in the world is in the market for the same products. And let me also reassure people, people may remember that when this outbreak first started in China, one of the things that we did when we were repatriating Canadians was we sent over a plane full of supplies to China, much needed supplies. Those supplies, we've been told, have already been replaced in our supply chain. So this is really about finding new ways for us to create our own supplies. I think your characterization is accurate. I think it is virtually unprecedented. It's the kind of thing that starts to happen during wartime, right? That you have to start changing factories into doing different things. We're standing by to bring you a press conference from the Prime Minister. I'll just leave Vashi and David for a moment if I can, and bring in a doctor who might be able to give us some much needed perspective on the kinds of things that doctors need right now. And we're going to go to Dr. Christopher Carlston, if we can, who is head of respiratory medicine at UBC Department of Medicine. Doctor, thank you for joining me. I really appreciate it.
Good morning.
Can you tell me what your sense is of the equipment, the supplies we have that are needed to treat COVID-19? And there I'm thinking specifically about ventilators. We had been reporting that Canada has around 6,500 ventilators, but obviously there is a need for more.
Right, Rosie. Yeah, you're right. The reality is that it's really all about what's going to happen in the next few weeks, hopefully not months, but certainly weeks. We are okay now, at least in Vancouver, but we're preparing for the worst. And that means, as you said before, that everyone as a team really has to carefully think of all the options and be very nimble on the ground. For example, we're looking at older ventilators that were decommissioned, that are in basements. All of these are options. We're looking for new ventilators potentially. I've had an endless stream of contacts from all around the world from innovators who want to bring in a new product. And of course, that comes with safety issues, but we're not leaving anything off the table.
How important is a ventilator in treating COVID? I mean, I'm sure people have read the accounts of those who have been hit hard by it, those who have even died from it. It does seem like a ventilator is really your only chance. Is that fair to say?
Well, at the extreme of the condition, absolutely.
Yeah.
I mean, this is a condition that's associated with respiratory failure and the unfortunate ones that get to that point. We also have to remember that we have our usual caseload. So our ICU at Vancouver General Hospital, for example, is typically full. That's without COVID-19. So as you said before, it's also the issue of who gets displaced and using alternative modes to take care of those patients. So we have to be very creative and very quick on the ground. And thankfully, the team has really mobilized for that.
And what about people to actually use the ventilators? Because you have to be trained to use these things. So any concerns around that?
Oh, for sure. As you said, the ventilator doesn't operate on its own. It needs to be adjusted and tweaked. So one of the things that the government's doing, which I much appreciate, is loosening some of the restrictions on the regulations for licensing. And people are coming out of retirement. Those that haven't been licensed yet, but soon would be, that's being accelerated. So I think quite appropriately under this emergency situation, we're loosening the criteria a bit to get through this.
Okay, Dr. Carlston, I'm going to leave it there for now, but I hope you'll stick around so I can get a sense of your take on what the government announces shortly. Thank you very much for weighing in, though. I appreciate your medical expertise.
Sure.
I'm actually just going to go back to David Cochrane for one moment, if I can. He has a little bit more news on what we're expecting to hear from the Prime Minister. As we know, there are many Canadians stranded in various countries around the world, and there has been some effort to try and help those Canadians get home, David.
Yeah, Rosie, what I'm being told by senior government officials that we're going to get news of the first flight to help Canadians who are stranded abroad. We know that there was this urgent call for people to get home as best they could, but some efforts have been made by the government to repatriate people as best they can. This is a far more complex situation, obviously, than the Canadians who were stranded in Wuhan in the early days of this. in January, which feels about 5 years ago now at this point, because people are sprinkled over dozens, if not hundreds of countries around the world. And we know that they have been having conversations with the head people at Air Canada and with WestJet on what measures that they can take to do airlifts, essentially, to get people back to safety in their homes. I'm not sure this would necessarily apply to people who live in other countries, have dual citizenship, and are content to stay there. This is largely, I think, for people who were on vacation for a matter of weeks and now face the probability of it going on much longer. So we're going to hear some news from the Prime Minister on that, including specific details of the first flight to bring stranded Canadians home.
Okay, that's really important. I have a lot of people, I'm sure everyone is the same, reaching out to me to ask for help. We've heard of Canadians stranded in Morocco, in Peru, which is not letting anyone in or out. I will say that the U.S. State Department is beginning to put together some charter flights to get Americans out of different countries where they have been stranded. And I'll also mention that Sunwing managed to repatriate some Canadians, I believe just yesterday, and offered some free seats on repatriation flights to stranded Canadians there too. Other news on the airline front, because the government obviously appealing to these airlines to help them with this at a time when airlines are struggling. Air Canada is expected to lay off more than 5,000 flight attendants. Probably in the coming days here. So obviously under a lot of strain, that industry, and we know that Minister Garneau has talked about the need for financial aid for that industry moving forward. As we wait for the Prime Minister to come out again from his home at Rideau Cottage, let me just go to our new friend, my new friend anyway, CBC's Chris Ensing in Windsor, because tonight we are expecting the border to close overnight at the same time as the U.S. is now discussing similar measures with Mexico. Chris, give us a sense of what you're hearing from people who are going to be directly affected by this.
Everybody's day-to-day life out here, Rosie, depends on that border. Essentially, it's hard to find a family not affected. We've heard from families who have parents that live on this side of the border in Windsor, and their kids live in Michigan, inside of Detroit. So that connection there is really important, and having that mental block, that physical block of that border not being able to crisscross if they're not essential services, it's weighing heavy on a lot of people, that anxiety, that anxious feeling. You guys have been talking about essential services being allowed to go back and forth, truckers toughing it out. I looked up some numbers here to get a sense. It looks like there are 203,000 trucks that went across the Ambassador Bridge in January alone, crisscrossing the border, about 340,000 passenger vehicles. So we're going to expect one of those numbers, the passenger vehicles, to dip, and the traffic that you can see from the essential services going back and forth to keep that supply chain going will be huge during all of this. And again, a lot of those people who work in Michigan that are from Windsor in that healthcare industry, we've been told time and time and again that the frontline workers there really are depending on Canadians in Windsor to be able to cross that border to help as they battle the coronavirus in Michigan, where the number of deaths are continuing to rise, which is something that we've been watching closely here in our community.
Okay, Chris, I'm going to leave it there if I can, because we are expecting the Prime Minister about a minute's time. We may come back to you a little bit later, but thank you for that perspective. Chris Ensing in Windsor. Let me just take you again to the Prime Minister's home there, Rideau Cottage in the nation's capital. Just point out, as one of our producers noticed, the podium has changed a little bit. There's actually now a board, a sign, I should say, in front of the podium that mentions Canada.ca/coronavirus, just to hit home to people that there is a website, a government website, where you can go and get a lot of practical information about the things the government is doing, either from a public health perspective or to help you in terms of the economy, and if you are feeling that you might be laid off and you have concerns around that. I'll bring in Vashi just for another minute. We're told he's going to be on time, so maybe about a minute, Vashi. I mean, there's a lot of different fronts to this story today, whether it be this move to try and get manufacturers involved, repatriate Canadians, and the border, a lot of moving parts.
Yeah, most definitely. I think Canadians are most interested in exactly what you and David highlighted, the ability to get them home. Like you, I've been hearing from them nonstop. In particular, many of them who just can't find a way to get back. So I think the Prime Minister had signaled this would be coming. They will be very much interested in the details. I know from the government's perspective, the industry announcement is a big one, and it is significant because that will become, fulfilling those needs will become something that's very important along the supply chain, the level of preparedness. It is already important, but it will become even more important as the number of cases rise. But I really think that the border restrictions, very relevant to so many millions of Canadians right now, as well as that ability or the capacity to go get them, the number of Canadians who are stranded. I think there are a lot of people very keenly interested in those details as well.
Yeah, and just to bring people up to speed on where this country sits in terms of the cases, the number of cases of the coronavirus right now, at last count, over 800, nearing 900 cases. And remember, we do expect these numbers to grow fairly rapidly, but that's because the testing is also growing and ramping up at a very fast speed, 25,000 tests this week alone. All right, here is the Prime Minister emerging again from his home, Rideau Cottage, where he will speak to Canadians and bring us some news about government measures today.
Before I begin today's announcement, I want to say a few words about travel. We are currently in discussion with Canadian Airlines to help Canadians to come back home. We will have more details to announce, but I can tell you that the first flight will leave Morocco over the weekend. As I announced on Wednesday, Canada and the United States have concluded an agreement to prevent non-essential travel, particularly tourists. Trade will, however, continue. This measure will come into effect at midnight tonight. Minister Blair will provide more information on this later today. Furthermore, Canada and the United States are announcing a mutual agreement under which we will now send back irregular migrants trying to cross the border.
We're in discussion with Canadian Airlines to help Canadians stranded abroad come home. We will have more details to share, but the first flight will be picking up Canadians from Morocco this weekend. As I announced Wednesday, Canada and the United States have agreed to stop non-essential travel, specifically for tourism and recreation. Trade and commerce will continue. This takes effect at midnight tonight, and Minister Blair will give more details today. Further, today, Canada and the United States are announcing a reciprocal arrangement where we will now be returning irregular migrants who attempt to cross anywhere at the Canada-U.S. border.
Over the last week, the entire country has mobilized to slow down the spread of COVID-19. Doctors and nurses in retirement have come in to help in the hospitals. And people administering the screening tests and researchers looking for a solution always are working longer hours. The important thing is that people follow the instructions from our public health officials. Frequent hand washing, working from home, limiting travel in order to protect our health and the health of others. But it's not only individuals who want to help their communities. Businesses as well are stepping up. I think, for example, of grocery stores that are opening an hour earlier to serve the most vulnerable Canadians, or manufacturing companies that are asking what they can do to help. Just last week, a number of companies right across the country contacted our government to offer their assistance. I want to thank them for their solidarity and their generosity.
This week, many businesses put their hand up and asked us what they can do. So today we're announcing a new strategy that will make it easier for companies to help out during this critical time. We are launching Canada's plan to mobilize industry to fight COVID-19, to ensure that we can quickly produce here in Canada the things we need. This initiative will help companies that are already making things like masks, ventilators, and hand sanitizer to massively scale up production. It will also provide support to those who want to retool their manufacturing facilities to contribute to this fight. For example, the Auto Parts Manufacturers Association reached out to us asking how they could help. Our healthcare professionals really need support, so our government will help these companies shift production from auto parts to medical supplies. We're also closing to reach agreements with several other companies, including Thornhill Medical, Medicom, and Spartan Bioscience. Minister Bains and Minister Anand will have more to say on this later today. Our government is also creating new, innovative procurement streams to allow more businesses to develop solutions and products Canadians need because of COVID-19. We will expedite these streams so firms can get to work quickly and these products are ready to use as soon as possible. Canada is home to some of the best innovators in the world, and with this new initiative, we will harness their talent and know-how to get through these challenging times. Aujourd'hui,
today, we are launching a plan to mobilize industry to fight COVID-19 so that we can rapidly produce the articles we need here in Canada. Through this plan, companies that are already producing respirators and masks and hand sanitizer will be able to considerably scale up their production. We will also be supporting those that need to buy equipment to allow their plants to produce the articles now in demand. For example, the Auto Parts Manufacturing Association has reached out to us to see how it can help. Our healthcare professionals really need our support, and therefore our government will help those companies to produce medical equipment rather than auto parts. We are also reaching agreements with a number of other companies, including Thornhill Medical, Medicom, and Spartan Bioscience. Ministers Baines and Anand will have more to say about that later today. Our government will also be introducing no innovative procurement streams in order to allow a larger number of businesses to develop solutions and products that Canadians need because of COVID-19. We will quickly be expediting this new process so that companies can get down to work as soon as possible. Canadian innovators are among the best in the world, and with this new strategy, we are putting in practice and using their talents and their knowledge in order to help us come through this difficult time together.
Over the past week, Service Canada and many government agencies have received a historic number of calls from concerned Canadians. We received over 500,000 applications so far this week, compared to just under 27,000 applications for the same week last year. I know people are anxious to get the help they deserve, and our government is working as fast as possible to support them. This is, of course, an unprecedented situation, and it's putting a lot of pressure on our system, but we're on it. Thousands of public servants are working around the clock to help you. I know this past week has been hard on people for many reasons. Working from home while the kids are running around, not being able to visit your parents at their nursing home, not hanging out with your friends. It can take its toll. But it is in these challenging times that we also see what we're made of. This past week, no matter how difficult, was further proof that Canadians are generous, kind, and compassionate, and that should give us all hope. We all understand our responsibility as Canadians. We have to do the right thing, whether it's working from home or practicing social distancing, to protect our nurses, doctors, and everyone who works in our healthcare system. To deal with this crisis, we need everyone, citizens, businesses, and governments, to come together and do their part. That's what we've seen right across the country. I want to thank all the workers who are stepping up and all the companies who are making things our country needs. If you own a business and you're wondering what you can do, reach out. We need your help. Canadians need your help. And our government is ready to work with you to maximize your impact. I will end this morning by addressing all those celebrating Nowruz today and this past week. This is usually a time when friends and families gather around the half-seen table and share a festive meal, but this year is a bit different. To the many families who've been spending their first Nowruz without loved ones lost in the Ukraine International Airlines tragedy, know that all Canadians mourn with you. I also know that many have had to postpone festivities because of COVID-19, and I want to thank you for that as well. Social distancing is crucial in limiting the spread of the virus, and we do this now. Soon we will be able to celebrate together. In the meantime, I want to wish you all a very happy New Year, Nowruz Etan Piruz, and I look forward to marking the occasion with you again in the future. Encore une fois, merci.
Once again, thank you for being here. I would now be pleased to take your question.
Hi, Prime Minister. Molly Thomas, CTV National News. You say that you're working with private companies to mass manufacture ventilators, masks, and tests. I mean, how fast Can a private company actually produce ventilators, for example, up to standard? And can this keep up with the rate of what we're seeing, 50 new cases in Ontario already today?
We know that Canadian companies are among the most innovative and agile in the world, and we are very confident that we're going to be able to work with them to respond to the pressing needs in our healthcare system.
Timeline on that.
We are confident that our companies that are among the most innovative and creative in the world will be able to respond to this request quickly, and Minister Anon and Baines will have more to say about this at noon at their press conference.
Soon.
Monsieur Trudeau, Philippe Vincent Fossé, Radio-Canada.
Radio-Canada. Now, to what extent the efforts that you're asking of these companies looks like the kinds of efforts we saw during World War II? And with respect to Roxham Road, exactly how will this work? Will there be a barrier? Will people be sent back? How will it work? Well, this is a measure where people arriving at the border, if they're irregular migrants, will be sent back and put back in the hands of U.S. authorities. And this is a temporary measure that we're introducing, and it will remain in place as long as this crisis exists. It's an exceptional measure in order to protect our citizens. Well, in terms of the current efforts, we will continue to work together. We know that these are exceptional circumstances, unprecedented circumstances. Some people are relating it to a war situation or other major economic crises. We will do whatever we need to do.
We recognize that the efforts we are going through are unprecedented. These are historic times in which we need to do everything we can to support Canadians and mobilize all our efforts in smart ways. There are people who are talking about historical echoes, whether it was wartime or Great Depression. We're focused on doing what we need to do right now. We know that Canada has never faced a situation like this, and we will face through it together.
Prime Minister Olivia Stepanovich, CBC News. California is under an official state lockdown to deal with COVID-19. Why isn't Canada putting stricter measures in place to ensure or enforce that people practice social distancing and do a self-isolation? And is Canada considering following California's lead with a lockdown?
We are seeing Canadians right across the country take on social distancing, take on measures that are protecting citizens. We know there's always more to do, and we will continue to work to encourage people to stay home, to practice social distancing, not just to protect themselves, but also to protect our healthcare workers and the system that is working so hard to keep so many Canadians safe and healthy. This is something we're going to continue to look for. We'll always be open to taking new measures, but we are continuing to impress upon Canadians how important it is to do just that.
Is Canada considering a lockdown?
We are looking at all possible different measures. As I've said repeatedly, nothing is off the table. But, we will continue to announce measures that become necessary. Right now, I want to congratulate and thank the millions upon millions of Canadians who are using social distancing and intelligence themselves safe, to keep families safe, and to keep health present. Millions de Canadiens qui ont fait des choix.
Press conference having a little technical difficulty here. As soon as we get back a stable shot and we're able to hear the Prime Minister continue to take some questions from reporters, we'll bring that to you. I'm sure everyone has felt systems being overwhelmed as of late as more people use phones and the internet, and this could be related to that. So anyway, we'll bring that back to you just as soon as we can. A couple significant announcements there from the Prime Minister today. First, on that issue of how industry might help going forward. to create and secure our medical supply chain. He says that basically they are going to do everything they can, that these are historic times and they need companies to mobilize. Maybe I'll go to Vashi quickly while we wait to see if we can get back the Prime Minister, just for your perspective on what we heard there from the Prime Minister.
So you're absolutely right. A lot of significant announcements. What I want to start with, though, is the statistic that he gave that kind of took my breath away. That's actually one of the saddest things. I know we expected it, but... Okay,
Vashi, sorry, I'm going to interrupt you because we got him back. I'll come right back to you, I promise. Here's the Prime Minister.
People will make decisions in consequence based on their own choices. I think that's the important part that we're continuing to advise people about.
Parfait, on va maintenant passer aux questions des journalistes sur la ligne. Modératrice, c'est à vous.
Thank you. Merci. We will now be taking questions from the telephone lines. Our first question, notre première question vient de David Youngbrun with Reuters Ottawa. Please go ahead. À vous la parole.
Yes, thank you, Prime Minister. Do you think Canadian athletes should go to the Tokyo Olympics even if the Games are not called off?
I think that's an important question that many athletes and coaches and family members are asking themselves. As they continue to train happen for a few more months. I have heard directly from Prime Minister Abe that he is intent on continuing to hold these Olympics, and I congratulate him for that decision. But obviously, Canadian athletes and the Canadian Olympic team will be making its decision as we get a little closer. Je reconnais que nos athlètes et nos équipes sont en train de s'entraîner pour les Olympiques qui s'en viennent au mois de juillet. Je reconnais aussi que le Premier ministre du Japon, Shinzo Abe, a annoncé qu'il tient absolument à continuer avec ces Olympiques. Mais les équipes et les athlètes canadiens vont prendre leurs décisions dans les semaines et peut-être le mois à venir par rapport à notre participation, dépendamment de des circonstances.
Everything depends on the situation in Japan and around the world.
Thank you. Merci. Notre prochaine question is from Emily Bergeron. Please go ahead. À vous la parole. À vous la parole.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. There's a great deal of concern about diagnostic testing. Some provinces are concerned that not enough testing is being done. Now, with these new efforts with Canadian companies, will that help? Well, yes, absolutely. What we're announcing today will help. But I can also say that in recent days, I've seen new approvals of different types of tests that will be available to the provinces. We are currently ramping up the number of tests right across the country. Just in recent days, we saw a huge increase in the number of tests being administered on Canadians. We also heard from other jurisdictions that this is a very important part of preventing the spread of COVID-19, and we will have enough tests for everyone to meet needs.
Thank you. Our next question, notre prochaine question, is from Justin Lang. Please go ahead. À vous la parole.
Hi, Prime Minister. There is concerns that prison and detention facilities are particularly risky vectors for transmitting COVID-19. Some states and other countries have done things to reduce the prison population. Is Canada considering that? And secondarily, yesterday your plan was to detain migrants crossing into Canada in federal facilities. Now you're planning to send them back to the U.S., where they may be interned in ICE detention facilities and potentially even deported back to South America. Is that wise?
First of all, on Corrections Canada, I can assure you that the Minister of Public Safety is engaged with the head of Corrections Canada to take measures to keep our incarcerated population safe. That is something that we are looking at very carefully, and we understand the heightened risks in those institutions. In regards to the agreement we just worked out over the past 24 hours with the Americans, we recognize that these are exceptional all times, and someone who comes to the border to request asylum will be turned back to American authorities, as happens right now when someone comes to an official border crossing and requests asylum. We turn them over to American authorities at the border where they are released almost immediately into the American, into the United States. They are, for the most part, people who are legally in the United States, and that is something we are confident about. We also have ensured that we are comfortable with this process as being in line with Canada's values on the treatment of refugees and vulnerable people. Okay. Nous reconnaissons
We recognize that this is a temporary measure in terms of sending back migrants trying to cross the border irregularly, and this would be the same thing for someone coming to the border based on the regular process and requesting asylum. We send them back to the U.S. authorities, and we are ensuring that the processes used are in keeping with Canadian values.
Thank you. Merci. Notre dernière question, our last question, is from Mary Vastel. Please go ahead. À vous la parole.
Oui, bonjour, Monsieur Trudeau. J'aimerais continuer sur cette
Yes, I'd like to continue in the same vein. Yesterday, you announced that with respect to Roxham Road, people would be placed in quarantine. Why did you change the tone some 24 hours later? Is it because you don't know where to put them? Are you lacking resources? Or suddenly you have more concerns about a possible infection? No, not at all. People who came in at the beginning of the week are currently in isolation, and that is a step we had already put in place. But at the same time, we have been working with our U.S. counterparts to try and find a way to develop these people somewhat differently if they're crossing the border as irregular migrants. For a number of years, we have been discussing this with the U.S. to try and find or develop a measure like this one. And we were able to agree on this process on a temporary basis because of the COVID-19 crisis. But yesterday, we had not yet been able to agree on this with the United States. Now we have that agreement, so obviously people who have crossed up until now will be in isolation, as I said yesterday. But in future, people trying to cross the border will be returned to the U.S. authorities. But as I said, this is a mutual agreement with the United States that was reached just a few hours ago.
Merci tout le monde. Bonne journée.
All right, that is the Prime Minister of Canada addressing Canadians now for the fifth day from his home, Rideau Cottage, where he is self-isolating with his family. Lots of news today, and lots of it really important to you. So let's bring in both Vashi Kapelis and David Cochrane. And Vashi, I cut you off, so I will let you go first.
Understandably so.
Yes.
Yeah, I was just in the middle of saying that there is a lot of news out of what the Prime Minister said today, but primarily I was struck by the statistic that he offered on the number of applications for assistance this week, for financial assistance for EI. 500,000 is what I believe he said, compared to 27,000 last week. I know that we were sort of anticipating that in and we knew that something along those lines was coming, but those numbers are staggering, and I anticipate that they will only increase because more programs are being made available. On the second part, the sort of big significant things that came out of this, we had talked prior, David had delivered the news that they were going to announce the beginning of the effort to repatriate Canadians, and in fact the Prime Minister did say the first plane would be coming from Morocco over the weekend. As well, the overall industry announcement, the idea that they're going to retool all the programs that they have to fight and sort of mobilize them to fight COVID-19. COVID-19 and to better prepare Canadians as well as healthcare workers for what is coming. As well, the announcement on the agreement with the United States for the restrictions at the border that will come into effect at midnight tonight. I know we'll have a lot to talk about there. The one thing I wasn't expecting that I'm going to say did take me by surprise is the idea that, or the announcement rather, that another agreement has been reached with the United States to turn back on both sides of the border anybody who crosses in between official points of entry. And that is something that we have covered for years as a political story, very heated political issue in Ottawa. But the idea of, particularly, let's say at Roxham Road, of people who were crossing by foot over those official points of entry. The Conservatives have criticized the government for allowing that or for saying that it could go on. They have always insisted that they were complying with international law. The Prime Minister was asked repeatedly about it. He says that this still does comply with international law. I'll be interested to hear the reaction to that throughout the day. But he says that they have reached this agreement on both sides of the border to turn those people back.
Yeah, that to me also stood out as the two things, I guess, as you say, the huge number of Canadians reaching out for assistance, 500,000 in a week. I suppose we shouldn't be surprised with that number, but that number is going to grow. I mean, just today we see Air Canada about to lay off 5,000 people, and the Prime Minister trying to reassure Canadians that the systems, the IT systems in place, that they are working hard to make sure they can handle that capacity. But I'll go to the regular border issue, and David, you've covered this extensively as well. Since 2017, about 54,000 people have entered at irregular border entries. So remember, people doing that because that was the way to get into Canada without the Safe Third Country Agreement being implemented. I wonder, David, I mean, I guess my initial question would be, this is temporary, but given that there was so much pressure on the government in the first place to try and shut this down, you have to wonder how this is going to work going forward. This is a significant policy change.
Yeah, everything the government is announcing these days is temporary, but it all has an air of permanence to it, Rosie, because we have no idea how long any of this is going to last. And I think I was there in August of 2017 when the surge of primarily Haitian migrants was coming across the border, and we were one of the last camera crews to sort of get unfettered access to the border until it became really, there's permanent infrastructure there now that didn't exist. So that is a component, I think, of the larger theme of what we're seeing through these day-by-day announcements, is the marshalling and funneling of Canada's industrial and human capacity towards a single solitary purpose. And that is slowing and containing and mitigating COVID-19 as much as possible. Because if you were to allow the Safe Third Country Agreement measures to remain intact and people continue to come across the border at Roxham Road at the level, and who knows what would happen with the COVID-19 situation in the United States, whether or not that would accelerate, you have to divert border agents, healthcare workers, law enforcement, and just social capacity to dealing with that particular issue. So this takes a variable off the table so you can focus on dealing with your domestic population and what is happening there. So I think that's a key part of what's going on there.
Can I just interrupt you for 1 second on that point? I just find it so interesting, though, that I mean, he said it took 24 hours to reach this agreement with the United States. When he was asked about it just yesterday, there didn't seem to be any movement or flexibility on it at all. So not that either of us know the answer to this right now. I just wonder how this came about so quickly and why such a, I understand what you're saying. It makes sense in terms of, do you want to quarantine a bunch of people? We didn't know where they were going to go. There were all sorts of questions about how many people would come across. But
I have a theory.
Okay, good. Because conservatives were already asking the government to do this, right? Just in the past couple of days. Go ahead, David. Yeah.
Right, but if you look at the announcement yesterday, normally the way it works, if someone crosses the border in a regular fashion, say at Roxham Road, they're intercepted there by the RCMP. They're essentially put into arrest. They're brought to a processing center, which is in the town right next door, and then they're sent into Montreal for temporary housing. Quebec had raised a concern with the federal government saying, we can't handle this. You need to handle this. And Marco Mendicino, the rookie immigration minister, was put in charge of that yesterday, and the agreement was that the federal government would take on the responsibility of finding housing for people and finding shelter for people who came across this way and ensuring that they were putting in quarantine. So they took it off the provincial government's plate, put it on the federal government's plate. Now they're putting it back on the American plate and saying we're not going to keep these people. So I mean, there's no irregular migration really from Canada to the U.S. It's really a northern flow. And I think it simply becomes a question of capacity being overwhelmed by something that is a variable outside of what you're dealing with internally.
Yeah, so I hear what you're saying. It may have been also an enormous amount of pressure from Quebec to say, forget it, we're not doing this. Sorry, just one more. You wanted to make another point, and then I'll move on.
No, there's a little bit of news. You talk about, he was asked questions, the Prime Minister was asked questions about moving from sort of the mitigation measures we're dealing with now to suppression measures based on the extraordinary news out of California that essentially the 5th largest economy in the world is on total shutdown. Well, the governor of New York has now ordered all employers to keep workers at home except essential services and bans gathering of any size, not less than 50 of any size. So a border state has taken that measure. And of course, New York is where a lot of people were coming across the border to get into Roxham Road.
Yeah, okay. Good information. I'll come back to both you and Vashi in a moment's time. Let me go again, though, to my colleague Chris Essing in Windsor, because those border restrictions are going to happen as of midnight tonight, meaning that non-essential travel no longer possible between Canada and the United States. Chris.
Yeah, not a lot of details to further explain any specific measures beyond what we've already heard, the idea of it coming into place today. But we have been told Public Safety Minister Bill Blair will have an update later when the ministers start briefing, so it'll be interesting to see the specifics around there. Again, a lot of it has to do with essential workers that are going back and forth. The healthcare industry here in Canada, there's that desire to have nurses on our front lines. It's the same feeling in Detroit, where there's about 2,000 nurses, healthcare workers, professionals from Windsor crossing over every single day. We're expecting to see that to continue in the coming days. But Rosie, just to pivot here for a sec, we heard about the manufacturers and the ramping up and the change and the desire for them to go into healthcare mode to try and build supplies, ventilators, masks, gowns. I was talking to the head of the Automotive Parts Manufacturing Association earlier this week, Flavio Volpe, and he had talked about there's a strong desire here in Windsor-Essex for that to happen because we're an automotive town. We have the manufacturers, we have the plants and the people who want to make that switch, but it doesn't necessarily mean that it's going to be easy. We were speaking with one mold maker in Windsor who already works in the healthcare industry, already creating parts. His concern, though, is staying open with supplies that he needs to make those parts. He says that it looks pretty thin 2 weeks from now when he's trying to model out what happens next. Again, this is an evolving situation with so many different things happening, but that's from somebody already making parts for the healthcare industry in Windsor-Essex. So when we think about that switch and that desire for the auto parts makers to step up to the table, there's going to be some challenges with that as well, as far as where you're sourcing the supply to create those products to then push them forward. And then the changeover itself, how quickly, how rapidly can all of this happen at a time when workers are worried about their safety, making sure that they're going into the places that they call, their careers. And if they're going to shift into something new, they want to make sure that they're protected and following the proper safety measures that we've all been told to, social distance, stay away from others. We've heard from employees who are worried about that on the front lines of these industries that are starting to make that shift.
Yeah, and one of the other concerns I know the government is also concerned about is the sanitization of plants, right? How do you get a plant to move from one to another? Yeah. Because these are obviously big concerns. Chris, I'm going to leave it there for now. Thank you again, Chris Ensing in Windsor. But I should tell you that the Canadian ambassador to Morocco has just tweeted out an urgent message that there are seats on a U.S. repatriation flight for Canadians from the Marrakesh airport, the flight leaving in 1 hour. If you have someone there that you know, you're supposed to look for staff in bright green vests. And indeed, we have someone who's in Marrakesh right now, Keenan Orange. He is about to get on a flight from Morocco to the UK. Keenan, I think it was your mom that ended up getting you that flight. Moms always come through. Tell us what it's been like for you.
Yeah, she did. She was really diligent in refreshing the web pages to get the flight, which is the only way to get a flight right now. But it's been interesting, to say the least. Right now, Canadians are, up until this news that you just announced about the ambassador replying about these repatriation flights to the States, as well as an email that was just sent out about flights this weekend for Canadian citizens, we've been having more discussion with the embassy to the UK and France here and getting on their repatriation flights over the past 3 days in an effort to get out of the country.
So even though your mom came through here to get you out of Morocco to the United Kingdom, I mean, the fact that there are these repatriation flights, seats available for a flight in 1 hour or a flight on the weekend, does that make you reconsider what you're about to do now, or are you just going to get the heck out of there?
Well, you know, it's funny you should ask, because I was just put on standby for this flight. Even though we did the web check-in, there's been not a lot of rhyme or reason for a lot of these procedures, and the common denominator seems to be that it's a lot of stuff is by chance. So the fact that these new flights are announced for this weekend does offer me some reassurance. But if I can leave in the next couple hours and then get on a plane to Toronto tomorrow, it will get me home soon. So that would, if that's a possibility for me, I will still get on the plane.
How has it been for you in terms of, you know, hearing these messages, come home, come home? I'm sure your mom's sending you the same message, and struggling struggling to get home. Like, how have you been anxious? Just give me a sense of how you've been coping with that.
I've been back and forth. My situation's been a bit better. I had hired some guides here for a trip, and they were putting me up and looking after me the past 3 or 4 days, which I can't say the same for a lot of other Canadians. Being a part of the Canadians in Morocco Facebook group, where we're trying to pull together resources to get out, it's been a lot worse for a lot of people, because there's been a lot of misinformation, a lot of hearsay spread about how to get on flights, what flights are available, flights disappearing because or not becoming available because someone enters their credit card information too slow. It's like that's the type of those are the kinds of situations that Canadians were currently up against for days after that announcement was made that we need to get home as fast as possible. Right. And Morocco seems to have become the epicenter of impossible travel, or one of them in the world, because at least for Canadians, because all of our international flights back to Canada were halted. So the only way that we could get out was through a third country, and that's what our embassy was telling us, which it doesn't seem to be of much help. And like I said, again, we've been sort of frustrated because we've been getting more responses from the embassies for the UK and France in terms of how to actually get us on those flights than we have from our own embassy up until recently.
Okay, well, a reminder that if you look for a green vest, you might get on a flight out in an hour if you don't make your other one. And yes, there is this Air Canada flight coming your way on the weekend. So you've got a few options, which I'm glad to hear for you.
Yeah, these are both very good news. I'm sure many of us are going to be relieved, just because, like I said, the past 3 or 4 days have been incredibly stressful, as we need to rely on budget airlines and third countries in order to actually exit the country and get home.
Okay, Keenan, thanks for making the time. I appreciate it. I know there's so many Canadians in your position, and we hope you get home soon, and we'll talk to you on the other side. And I'm sure your mom is glad to hear that you're on your way almost.
Well, certainly.
Okay, thanks, Keenan. As we stand by and wait for ministers to join us, let me go back to Dr. Christopher Carlston in Vancouver, the head of respiratory medicine at the University of British Columbia's Department of Medicine. Doctor, thanks again for standing by there. We heard a lot of pieces of information from the Prime Minister, but obviously from your perspective, the notion that really they're going to throw everything they have at trying to get industry and companies to move over to shore up the medical supply chain. What did you make of that?
Well, I think it's inspiring, really. I was very happy to hear all of that. I think everyone should also realize that, at least on the ground in Vancouver, and I think from my colleagues nationally, there's no sense of panic. As I said before, we're really preparing. We have been preparing for weeks. And what the Prime Minister said is welcome, and I think will help. And I think we're doing everything we can, so people should be reassured that we are going to take care of them.
Given that British Columbia has been dealing with a large number of cases, I think second now to Ontario, how concerned are you about capacity inside hospitals? You said your ICU is always full. Do you feel like you're going to have enough room if things do get worse?
Honestly, I'm very confident that we will make whatever adjustments we need to take care of this population. I don't have the sense that we are going to have any kind of chaos that people fear, understandably. really because we've learned so much from others around the world, and we really have been preparing essentially 24/7 for this. And I really want to give credit to the team here in Vancouver, incredible people that have basically dropped everything for this, and I'm sure it's true at other places around the country.
And have you treated anyone with COVID-19 so far, tested anyone?
So that's the interesting thing. We have a very deep system of coverage, and people like me, you can see that I'm at home, and that's because we're carefully reserving our staff so that when others get sick, and we have had healthcare workers sick, and it will happen, we have people that are healthy that are ready to step in. So I've been here at home, and I'm on the schedule to jump in shortly, and I do expect that will happen, but so far I haven't.
Okay, well, that's interesting, though, that they're going to try and keep you healthy as well. I'm glad to hear that. Dr. Christopher Carlston, like many Canadians, appreciate all the work that you've done and all the work you're going to do over the next few weeks. Thank you.
Thank you.
All right, let me go to Deborah Arbeck. She's the host of CBC News Montreal at 6, and she joins me now. There's been lots of interesting developments in Quebec, Deborah, too. Most notably, this story today around the use of hotels to help with just what I was talking to the doctor about, their capacity.
Yeah, it's been a big concern here in Quebec, as the numbers grow across the province, where the province will stand in terms of housing all the patients that we might have. The health minister this week said that we have 18,000 beds in Quebec, but obviously all of the COVID cases can't go into those beds. They're specializing on where to put those COVID-19 patients. So as we begin to test, as we begin to see more cases and the number of cases go up significantly, what they're doing is trying to free up beds. So 6,000 beds in the healthcare network, the healthcare minister says, will be available. 3,000 of those, they say, they've come up with this creative way of providing perhaps as many as 3,000 beds in hotels. Now, we've confirmed that public health is asking hotels across the province to clear those beds in anticipation of that. We spoke to Hotels Association here. They say they wouldn't take in COVID-19 cases, but rather non-infected, semi-autonomous cases, and that the rooms would have to be near a hospital. I want to bring up another big issue that's still getting the message through to people about social distancing and self-isolation here, because so many snowbirds are coming back to Quebec now from the United States, and one community here on the island of Montreal, Côte-Saint-Luc, has actually declared a state of emergency. There were 4 cases of COVID-19 there. It's a community with a very large Jewish population, and 3 of those infected had attended a Jewish community center or a synagogue, and the 4th case lives in assisted living in Côte-Saint-Luc and actually attended a wedding in the Montreal area not too long ago. Of course, public health saying no big gatherings, stay away from churches, synagogues. So the synagogues on the island of Montreal have now agreed to shut down, and we're just hearing today too that the local mall in Côte-Saint-Luc has agreed to shut down as well.
I have about a minute and a half here, Deborah, but I didn't want to leave without talking to you about that very heartfelt plea on Facebook from Quebec's first victim, an older woman, and her family did speak out on Facebook overnight.
Yeah, it's really hitting Montrealers, Quebecers very hard. An 82-year-old woman who lived in a senior's home in the Lanaudière, so that's in the regions just north of Montreal. By all accounts from her family, that posting, while she did have some respiratory issues, so she did have some health concerns, she was otherwise very lucid, full of life. The family, really the pillar of her community, pillar of her family, and her grandchildren made that post. They said that, they said, please don't take her death in vain. They wanted Quebecers to understand that this is serious, that people have to self-isolate, especially the very vulnerable and high-risk group being the elderly. And they said, look, they want her death to save other lives. So very poignant and very touchy. It's certainly being shared right across the province.
Okay, Deborah Arbeck, host of CBC News at 6 in Montreal. Thank you. Appreciate you bringing us the Quebec perspective today. Appreciate it. And just to recap a little bit on what we heard from the Prime Minister earlier, as we stand by now waiting for the ministers to come out and provide us some more details. But the highlight, first of all, the first repatriation flight from Morocco will be coming back on Air Canada flight this weekend. And we have just heard from someone stuck in Marrakesh, so that will be welcome news to Canadians, and the government continues to find other ways to bring Canadians back. Also, the people that are trying to make entry across the border on irregular border crossings, that will no longer be permitted. Those people will not be brought into Canada. They will be sent back to the United States. That is a significant shift in policy for this government. And finally, a call for industry and companies to make a shift to try and shore up the medical supply chain in this country, whether it be ventilators or masks. The government really suggesting that it will help financially any company that wants to move in that direction. All right, that is it for us on CBC Television. Thank you for watching here. But we will continue our coverage both on CBC News Network and CBC.ca. You can stream that around the world, wherever you are, in case you are in fact stuck and want some more information. An update from federal ministers, and the Chief Public Health Officer coming up in just a few moments here on CBC News Network, as we leave you with scenes across this country as the COVID-19 pandemic changes life here. I'm Rosemary Barton. Welcome back to our continuing coverage here on CBC News Network or online if you are streaming us in this country or around the world. We are standing by at this hour to bring you federal ministers who are going to come out and tell us more about some of the measures the Prime Minister announced today, as well as the Chief Public Health Officer, Dr. Tam. Some significant moves again today by the government to try and help Canadians, to try and restrict and contain the spread of the virus, and to move industry and companies in this country towards shoring up how they can help, shoring up the medical supply chain. I'll bring in my colleagues, Vashi Kapellas and David Cochrane. They have both been helping us through these specials through the week as the Prime Minister speaks to Canadians really on a daily basis now, partly to reassure people, but also to provide specific information, and we'll hear more about the details of that from ministers. Vashi, what should we watch for here in this next briefing?
Well, I think as far as the details from ministers go, Minister Baines, who kind of heads up the industry aspect of these announcements, and you had talked about them, the shoring up of capacity on the supply chain where all industries are concerned. Expect some details from him on that. I am primarily looking to Minister Blair for details on two things that came out of this morning's press conference from the Prime Minister. The first is that agreement will come into effect, the agreement on border restrictions between Canada and the U.S. this evening, or overnight, I should say, at midnight. Apparently, President Trump has been talking, well, we have been saying that the Mexican border will be treated, I know he kind of tweeted something to that effect, but will be treated exactly the same, insisting that he does treat those two borders equally. So I'll be looking for the exact details, because we have been given very specific signals from the government such that, for example, what they are limiting is people who are trying to travel for leisure or just travel, period, but that other essential services, workers, for example, trucking, trade, all of that stuff will still be able to pass. So let's get the fine print. I'm anticipating that from Minister Blair. The second thing that I'm interested to see from Minister Blair, the Minister of Public Safety, is around that sort of surprise announcement from the Prime Minister that people who attempt to cross irregularly between official points of entry, which has been an issue for years in this country, will be turned back. And he said that agreement was reached with the Americans over the last 24 hours. He and other members of his government, the Prime Minister, I should say, and other members of his government have insisted that instead those people would be quarantined. For years, they've insisted that the announcement they made today couldn't happen, that it didn't comply with international legal standards. And so, how it unfolded, what exactly it means, how long it lasts, what does that word temporary that they used actually mean? Those are the very specific questions I have for Minister Blair.
Yeah, so just so people understand, if you are trying to cross the border at a regular an official point of entry, because of the Safe First Country Agreement, you will be turned back. That's how that goes. But people went to those irregular crossings, whether it be in Quebec or Manitoba, we saw places, because there the argument is that if you are claiming refugee status under that, as you say, international treaties, Vashi, then the government of Canada does have to take you in. And obviously this huge flux of people did come as a result of some of the measures that the Trump administration put in place. I should say one of our colleagues has reached out to the Canadian Council for Refugees, and their spokesperson, Janet Dench, says we are, quote, shocked that the government of Canada is not prepared to live up to its commitment to protect the rights of refugees and vulnerable migrants. I would remind people that the government says that this is a temporary measure, and it's obviously an unusual, extremely unusual situation, and they are trying to contain a public health outbreak, a public health virus, but we can already see some of the criticism about that decision. David, do you want to talk about that and maybe a little bit about the repatriation of Canadians? I thought it was really interesting to talk. We spoke earlier with a young man stuck in Marrakesh, saying that he really hadn't had a lot of communication from the embassy there, and he was feeling a little bit, left to his own devices.
Yeah, it sounds like, obviously, the flood of demands for communication at every level of government, domestically and internationally, is overwhelming at a time like this. And it seems like they aren't saying anything until they're ready to say something specific. So clearly there's a flight coming back from Morocco, to the first repatriation flight, and they're talking to WestJet and Air Canada to do more. We're going to get, like, you said it right, the way this has been working is the Prime Minister gives us the core message, and then the ministers come out and give us the mechanics. What I want to see is specifically how quickly they think they can tilt the industrial capacity of the country towards filling up our medical stockpiles. I'm getting yelled at a little bit on Twitter for something I said earlier, so I want to clarify. When I said there are strategic stockpiles with some surge capacity around the country, that is true. This is something that was set up when the Public Health Agency of Canada was created. There's a warehouse here in the Ottawa region with warehouses spread strategically across the country with pharmaceutical supplies and medical gear that can go deal with a crisis. They started in earlier this month, I think, and last month to backstop that even more, and now they're tilting up the industrial capacity. So I don't want to give people the false impression there's a huge stockpile of gear there because it expires, you can't do it. But I also don't want you to give the impression they haven't been taking steps to prepare and now taking extreme steps to extremely prepare because it's just the way it is. Like you go back to the fact that the whole world is looking for the same gear. You can't stockpile it because Italy might need it or China might have needed it. Now Canada's getting to the point where it's going to need it.
I would also say that the Public Health Agency, Dr. Tam, has said that we're at about 75% of the supplies that we need. On
masks and gloves. So there was a need for about 7 million. We have a little over 5 million secure.
That's right. And if there are doctors who don't have what they need in hospitals, that could be a provincial problem because they haven't sent it out to where it needs to be. And I would also say that the people that I've spoken to around this, David, have said that if they don't know, if they're not sure if they have enough, they're just going to buy everything and create everything they can. This is not a situation, the government says, where it's going to be cheap, for lack of a better phrase. They're going to take everything. Yeah, that's right.
And a key point yesterday too, Vashi, was that Dr. Tam said they do have an emergency reserve of ventilators, which they're looking to backstop. But to this point, there has been no request from a province for a ventilator. So while that is a big piece of equipment, we're all looking at and tracking, saying how many are we going to need, how many do we have? At this point, as they move towards getting more and more and more either built or bought or refurbished, there hasn't been a drawdown yet on the national stockpile at the provincial level.
Yeah, and it's also probably important for people to realize that after SARS, and as you say, David, when the Public Health Agency was created at that time period, there was, again, the need to start making sure that there were ventilators available and stockpiled. So that work has been happening really, presumably, for years in some ways. I'm just going to leave Vashi and David for 1 minute as we stand by and wait for the ministers and try to quickly fit in Tom Murphy. He's the host of CBC Nova Scotia News, and he is in Halifax. Tom, if I cut you off, you'll understand why, but give us a picture of how things are going in Nova Scotia.
Yeah, for sure. A couple of quick things. It's really interesting to watch this repatriation of Canadians literally happen in real time on your program, like so many. I'm receiving emails from people. In this case, a family that has a loved one stuck in Peru. Last couple of days, not much hope, but this morning they are expressing some relief. They think that help is on the way. This is before the Prime Minister even spoke, and they are crediting local politicians and federal politicians for working the back channels and trying to make all this happen. So there's some encouraging news there. Also interesting to hear the conversation about the medical supplies thing. Like every province, Nova Scotia has gone through its complete inventory. It knows where every glove, Band-Aid, and yes, ventilator is. We have 240 ventilators in this province, and the Premier has said they are ordering more through a national procurement type plan, if I can put it that way. Probably another 140 that they need. There are ventilators that had been piled up since H1N1 and SARS days, so they have been restocking. The question is, who do they get to operate this equipment if they need to get to that point? And to that end, Nova Scotia Nurses Union has said they've been getting a lot of phone calls from nurses, retired nurses and doctors, in the case of medical doctors, willing to come back into the system to work, to fill in. Maybe they can't do some of the, in the middle of the fire of COVID-19, but maybe they can help out in nursing homes and free up some of the staff there to move to hospitals and that kind of thing. So those kind of discussions are happening right now. Obviously, those are a lot of people who are very dedicated to their careers and to the work of the medical industry and the medical system. So that kind of thing is happening as well. And interesting as well to hear people talk about what can we do to help. You know, we've seen this across the country, but it's certainly happening here in Nova Scotia where, you know, distilleries are saying, okay, let's make alcohol with a higher content becomes more like a hand sanitizer, and they are doing that. And there'll be lots of encouragement for other companies, as you heard from the Prime Minister today, do those sorts of things as well. And on that point about the social distancing and the hand washing and people who are in self-isolation, in this province, at least, the Premier has said we believe things are going pretty well, although I think they see indications sometimes where maybe not everyone is following as much as they are because they keep repeating that message. But in New Brunswick, they've had to go farther, and they have declared a state of emergency in that province because they felt that they needed to become more aggressive. So that is shutting down non-essential businesses, you know, everything except for grocery stores, hardware stores, pharmacies, that kind of thing. And so they are really trying to wrangle the crowd in, get everyone on the same page with that. And finally, this notion about the border, it's obviously an issue in New Brunswick, a border community next to the state of Maine. Some people live in New Brunswick, work in Maine, vice versa. So there'll be lots of attention and interest in what the ministers say about that coming up.
Okay, Tom Murphy in Halifax, appreciate it very much. Good to get perspective from out east, and good to see you. I should tell people, Tom mentioned their repatriation of Canadians. I too have received many emails from people begging, me for help and information. I should tell you that the U.S. State Department is starting to put together charter flights for Americans stranded both in Morocco and Peru, and we now know that first flight will leave from Morocco over the weekend. So if you have someone stuck in Morocco, make sure they reach out. In fact, there's a flight leaving in an hour if you're at the airport right now. This is the Deputy Prime Minister, Chrystia Freeland. Let's listen in now to what she and her colleagues have to say.
Okay. Bonjour à tous.
Good afternoon, everyone. Thank you very much for joining us today.
Thank you for being here. Avant de commencer, je veux juste
Before I begin, I would simply like to thank everyone who is working so hard to protect Canadians against this global pandemic. People who are working in hospitals, physicians, people who are working at the borders, everyone working at airports to help Canadians come home. And I would also like to especially like to thank all Canadian children, because as a mother, I take this very personally. I know that it's a difficult situation for our children. So thank you very much to all of you.
And I'd like to quickly thank all of the people who are in Canada's front line fighting against this global pandemic. I'd like to thank the nurses, the doctors, all of the public health workers, all of the health workers, the border service officers, airport workers, and especially today, the cabin and flight crews and pilots who have been helping to get Canadians home. And speaking very personally, I would like to thank Canada's children and sympathize with them. As a mother, I have some sense of how hard it is for all of our children to be home in a time of social distancing. Having a long school holiday may have seemed fun when it was first announced, but when it also includes learning that you can't have play dates, that you can't spend time with your friends. It's really hard for our children. And I just want to say to them, thank you very, very much. So today we are going to hear from Canada's Chief Public Health Officer, Dr. Tam. We will hear from our Minister of Public Safety and Emergency Preparedness, Bill Blair, who's going to talk about the Canada-U.S. border. He will be assisted by Jean-Yves Duclos, our Minister of the Treasury Board, my colleague,
the Vice President of the Cabinet Committee on COVID-19,
Minister of Industry, Science and Innovation, Navdeep Bains, who is going to talk about building up our domestic industrial capacity. And we will hear from our Minister of Public Services and Procurement, Minister Anita Anand, who will be talking about the work we're doing on procurement, and our indefatigable Minister of Health, Minister Patty Hajdu is here, and Dr. New as well, and they're available to answer questions. Dr. Tam.
Thank you, and hello, everyone. Before I begin, I would like to express my deepest condolences to the family of the Canadian who recently passed away in Japan, a former passenger aboard the Diamond Princess. Our thoughts are with you and many others who have lost a loved one to this disease, both at home and abroad. Today, globally, there are over 245,000 cases of COVID-19 in over 179 countries. In Canada, as of this moment, there are 925 cases and 12 deaths. There are now 12 cases at CFB Trenton. We have tested close to 66,000 people across Canada. That's, again, over 10,000 persons tested since yesterday. Public health colleagues continue to investigate unlinked cases to uncover hidden chains of transmission in the community. One of our biggest concerns is when the virus is introduced into a high-risk setting, such as long-term care facilities. These settings are not only a concern due to the older and medically vulnerable populations that they serve, but also because a single case arising in these settings can quickly result in an outbreak and accelerate the rate of spread. If we are to slow the spread and lessen the impact of COVID-19, we must protect these settings at all costs.
One of the main reasons we want to delay and flatten the epidemic curve is to gain time to allow for research and innovation to proceed. We have an urgent need of or rather, we have an urgent need for urgent medical supplies if we want to optimize our chances of saving lives and to put an end to this epidemic. We must not forget that only 2.5 months ago, scientists isolated the coronavirus stream at an unbelievable speed. And the first development of vaccine against COVID-19 has begun this week. It is still too soon to know whether or how COVID-19 will develop over the next months, but by increasing our production capacity domestically, that will be a key element of our fight against this pandemic, and this will serve us today and in future.
One of the key reasons we wanted to delay and flatten this epidemic curve is to buy time for research and innovation to occur. We urgently need diagnostics, critical health supplies, treatments, and vaccines if we are to have the best chance of saving lives and bringing this epidemic to an end. Recall, it was only 2.5 months ago that scientists first isolated and then sequenced the novel coronavirus with lightning lightning speed. This week, the first clinical trial of a COVID-19 vaccine started, and an array of treatments are being tested. It is too soon to know what will happen to COVID-19 in the upcoming months, but mobilizing our domestic production capacity and integrating ingenuity as part of our pandemic response will serve us well now and into the future. We don't just need to flatten the curve, as I said, we need to plank it, and Canadians are listening. Everyone who is practicing social distancing and self-isolation is giving a chance to our scientists, private sector partners, manufacturers and governments to work together on novel solutions. This is our chance right here, right now. Thank you.
Thank you very much, Dr. Tam. Now we will hear from Minister Bill Blair about the border measures. Bill.
Thank you very much, Christian. I'd like to begin as well as the Deputy Prime Minister did by acknowledging and thanking all of the people that are working on the front lines. You know, police officers, EMS, firefighters, nurses, border officers, corrections officials, doctors, caregivers, even the people that drive our goods to the shelves, and those who are working in the stores have stayed on the front line and continue to serve Canadians, and we are indebted to them. And it's important to express our gratitude for the incredible work that they are doing in difficult circumstances. It's also important to acknowledge and thank Canadians who have taken, I think, such care in heeding the advice of our Chief Public Health Officer so seriously. I know that that is also bringing challenges to families and to people right across the country, but they're working hard and doing the right things. And by staying home and participating in social distancing, they're not only keeping themselves and their loved ones safe, but they're helping keep the country safe. And for that, we are grateful. We have, over the past few weeks, announced progressive and significant measures to restrict travel across our borders. And these decisions, I want to assure everyone, have not been made lightly. We know that this has been challenging for Canadians, but we believe that it is part of a larger group of measures, as advised and directed by our public health officials, that are important to keep Canadians safe. In response to the ongoing COVID-19 pandemic, we took the steps necessary to restrict international air travel for non-Canadians. We have entered into an agreement with our most important ally and partner, the United States, a reciprocal agreement to temporarily restrict all non-essential travel across the Canada-U.S. border. This agreement will take effect at 11:59 tonight. But I also want to acknowledge, since we announced these measures and as our officials have worked tirelessly to put them into effect, Canadians and Americans have been listening, and we've seen a significant decline over the past 24 hours in non-essential travel at that border. And at the same time, I have been very, very encouraged to see the extraordinary work of truck drivers, train operators, marine operators, and others who have continued the important work of delivering goods and services across that border, and that work will continue unimpeded. I also want to reiterate that we acknowledge that Indigenous communities, which often exist on both sides of the Canada-U.S. border. I want to offer them a reassurance that we recognize and acknowledge their right to travel and that it is essential, and it will continue unimpeded during this restriction. Canadians and Americans cross the border each and every day to do essential work. We acknowledge the importance of that work, and we're going to ensure we facilitate their crossing of the border so that they can continue to do the job that serve and keep healthy and safe Canadians and Americans. As I've indicated, trade and supply will continue because it's critical to our health and safety, and it will facilitate our economic recovery. Today, the Prime Minister made a significant announcement as a result of the continuing work we are doing in working with our allies and partners in the United States to keep our citizens safe. And the Prime Minister announced that we have entered into a reciprocal arrangement with the U.S. to direct back individuals who come to our borders with the purpose of making an asylum claim. I want to be clear that individuals crossing at an irregular point of entry, not at a regular point of entry as they exist, but in any other place, will now be directed back to the United States. They will not be referred to the Immigration Board and into our Immigration Refugee Board system, but they will be returned directly back to the United States. There will be necessary and limited exceptions put in place, But I want to also be very clear. We are taking this measure to maintain safety and order at our border, and at the same time, these measures will only be in place temporarily, as long as the agreement of the restrictions on non-essential remain in place. We believe that these measures are appropriate and necessary. They will be reciprocal, so individuals crossing from Canada into the U.S. or the U.S. into Canada will be treated the same. They will be directed back to the United States. And for those individuals who are already across the border and have already entered into our system, we have made the appropriate arrangements so that those individuals will continue through the process, but they will be accommodated in temporary shelter, which is appropriate to enforce the 14-day period of isolation which is necessary to ensure that they are safe and that Canadians are safe from their crossing. That work has been done and will continue to be done, and we will monitor that issue very carefully as we proceed forward, and as I've indicated, it will be in place effective at 11:59 this evening and will continue for the 30-day period subject to renewal as long as it is necessary to maintain the temporary restriction on non-essential travel between our two countries. Thank you very much, Christian.
Okay. Well, thank you very much, Bill. And
these measures are important for all Canadians and have particular significance for Quebec. Jean-Yves, would you like to address that? Yes, thank you, Christian. And as like everyone else, I would like to begin by thanking all our frontline workers who are doing extraordinary work. And I also have a thought for children who are very anxious as well. They're also isolated. And I should know because I have 3 at home, and they are extremely troubled by the situation. So I would like to reach out to all of our children and to reassure them that we must try and help each other in these difficult circumstances. I would also like to take advantage of this opportunity to thank Minister Blair for his extraordinary work in these extraordinary times. As we said, these extraordinary times call for extraordinary measures, and as Minister Blair has indicated, everything that is being done and that has been done over the past few days is being expedited. The closing of the border with the United States, that has never happened in the history of our country. These restrictions on the entry of foreigners has been done very quickly, and I'd like to thank Minister Blair once again, and just to point out once again that all asylum seekers, regardless of where they come across, if it is an irregular point of entry, they will be directed back to the United States. This is a reciprocal arrangement that has been signed with our neighbor to the south, and will come into force tonight at 11:59. And Minister Blair has also indicated that for all regular asylum seekers who are already present in Canada, as we have announced earlier this week, they will be taken into custody by Canadian authorities, so that there is no jurisdictional quibble, and our federal government is taking responsibility for these regular asylum seekers who are they will be placed in isolation for 14 days, just like all other travelers. Thank you. Thank you, Jean-Yves.
And now we will hear from Nav about how Canadian science and industry are stepping up to the challenge and the work Nav has been doing there. Please.
Thank you very much, Christia. And I want to begin, as my colleagues have said, taking a moment to recognize the incredible work of our nurses, doctors, technicians, paramedics, and other healthcare professionals. They are on the front lines of this, and they're doing a remarkable job, so thank you very much. I
would also like to thank people who do not work in the health care system, but who are working hard to ensure access to essential goods and services. For example, truck drivers, people who work in grocery stores, and telecom workers who are supporting the telework economy, among others. Thank you very much for the support that you are providing to all Canadians.
That as a government, we're committed to protecting the health and safety of all Canadians, and the effort includes the impressive and innovative power of Canadian businesses. Since the outset of this crisis, my team has connected with thousands and thousands of businesses across all sectors in Canada. Companies are already stepping up, like Dillon's and the Spirit of York distilleries, who have shifted their production to hand sanitizers. As the Prime Minister said, in times of crisis, Canadians come together. And every day, I've been in contact with Canadian businesses, many of whom are telling me they want to help. As we've always known, we have a world-class industrial base in Canada. And today, I'm asking them to come forward and let us know where they can help. Our objective is to increase domestic supply so that we have Canadian solutions ready to protect and support Canadians. So today, we're announcing Canada's plan to mobilize industry to fight COVID-19, which will swiftly create pathways to deploy resources to Canadian businesses who want to help in this crisis. This is a coordinated strategy that will leverage our industrial base to rapidly scale towards more Canadian production in the products that we need to fight COVID-19. I've worked in close collaboration with the Minister of Health and the Minister of Public Services and Procurement to mobilize our industrial response, and I want to thank my colleagues and their teams for doing a wonderful job. Le plan va mobiliser nos programmes
This plan will mobilize our innovation programs to support promising projects that will foster the protection of all Canadians.
Policy will be refocused for the time being to prioritize the fight against COVID-19. And this includes the Strategic Innovation Fund to deliver direct support to larger companies as well as research institutions. Canada's National Research Council to expedite research and development for small and medium-sized enterprises, and our innovation superclusters to help tap into the national network of 1,800 members, and Innovative Solutions Canada to help Canadian companies commercialize faster. Funds will be deployed on an accelerated basis with wider flexibility to be able to tackle COVID-19 related problems through shortened applications and faster approvals. We're putting the full weight of the federal government behind this plan. We will also leverage the purchasing power of government to address the immediate need to build domestic capacity and to help make sure that Canadian innovations get to the market faster. And I know my colleague Anita Anand will speak to that momentarily. Companies who are responding to the call to action will be able to directly let us know of their capabilities via portal on my department's website, which will go live today. Nous voulons que les entrepreneurs, les chercheurs,
we want researchers, industry, and business people to get down to work right away. Their work will progress as quickly as possible.
So far, we've signed letters of intent with 3 companies that we believe are well positioned to assist. Premièrement,
First of all, Medicom, a Montreal business which manufactures and distributes protective medical equipment, that is for individuals, such as masks and lab coats. They have agreed to manufacture N95 masks.
Precision medicine diagnostic equipment manufacturer headquartered in Ottawa, which is developing a version of its portable diagnostic device to provide rapid results for COVID-19. And if successful, its diagnostic platform and COVID-19 test could be used in airports and in clinics. The device could read the test result within potentially 30 minutes. And we're working with Spartan to secure Canadian supply of this equipment. And Thornhill Medical, a ventilator manufacturer located in Toronto that has stepped up and is moving forward to say they will do whatever it takes to rapidly scale up their production and to help Canadians' healthcare system succeed going forward. We're also working very closely with the Auto Parts Manufacturer Association of Canada, and I particularly want to acknowledge Flavio Volpe for his leadership in this endeavor, to support their efforts in having Canada's auto sector temporarily retool some of their existing facilities to make a range of possible products that, again, could help us in the fight against COVID-19. There are skilled workers out there who want to help, and companies offering their facilities. And this is what our plan is about. It's about aligning those employees, those individuals who want to help, and those companies that have the production capability. These are extraordinary times, and when we work together, Canadians are capable of extraordinary things. So let me sum it up. We want our healthcare professionals to be able to focus on doing their life-saving work without worrying about the supply of medical equipment. And our plan will ensure that we do exactly that. We want Canadians to know that as solutions are offered, we will invest to make sure that more domestic capacity is online as quickly as possible. Le gouvernement agit rapidement.
The government is acting swiftly. Right now, we are using all the tools available to protect Canadians' health and support our economy and businesses. We will adapt our response to the situation, which continues to evolve.
We are acting in a coordinated and meaningful way to address short-term needs and also set up the foundation for long-term domestic capability. And I have every confidence that in working together with the Canadian business community, we will be able to deliver breakthrough solutions, retool where we can, and scale up to meet the needs during this crisis and for the future. Thank you very much. Merci.
Okay, well, thank you very much, Nev. And I think it provides real hope to all of us to see Canadian science and industry stepping up in these challenging times. Okay, Anita, maybe you can talk to us about the work you're doing on procurement.
Thank you. Thank you so much, Christia and Nav. Bonjour tout le monde. I would like to begin by assuring Canadians that we are working hard to address the challenges of this extraordinary situation. We are all hands on deck to support a whole of government response. I too would like to thank Canadians across the country for the work that you are doing to keep our country safe, especially frontline workers. I'm going to today provide a brief overview of how Public Services and Procurement Canada is working in collaboration with other departments, some of the steps that we have taken, and how we are moving forward to help secure the goods and services that Canadians need.
Over the past weeks, Health Canada and the Public Health Agency have coordinated requests for supplies coming from provinces and territories, as well as federal organizations such as the RCMP and the Strategic Fund.
PSPC is leading the consolidated procurements of goods and services. We have stood up a dedicated team of procurement specialists who work incredibly hard each and every day, and I want to say thank you to them, with counterparts at Health Canada and Public Health, who are working together to source suppliers, work up contracting and delivery schedules, and expedite decision-making in these times. We are taking a whole-of-government approach, a Team Canada approach, to best meet Canada's needs during this extraordinary time. Now, to ensure that we have left no stone unturned, we published a call to action for suppliers on buyandsell.gc.ca last Thursday. We are inviting companies to fill out a simple form to provide information on their goods or services, including the quantities that they have in stock. Nous en avons fait la promotion auprès
We have promoted this to industry associations and all parliamentarians, and we are so that they can communicate this to suppliers in their communities.
Industry associations and circulated it to all parliamentarians. And together, we have had over 5,800 submissions from companies offering goods or services to to combat COVID-19, and we have been working very hard to triage these. However, the situation is fluid and evolving rapidly. Our goal is to be over-prepared. We are planning for the future by considering both current and anticipated needs as much as possible. For example, we have been able to secure 11.3 million N95 masks, which is over and above the order that we received for 7.3 million, with deliveries beginning immediately. Thanks
to the success of this call for tender and our current relationships with suppliers, we have been able to purchase a wide range of protective equipment and supplies, including gloves, masks, lab coats, hand sanitizer, and ventilators, as well as thermometers, among other things. Some supplies have already been delivered, whereas the rest will soon follow.
Through the success of the call-out and our existing relationships with suppliers, we have been able to purchase a broad range of personal protective equipment and supplies, including gloves, masks, gowns, hand sanitizers, wipes, ventilators, and thermometers, amongst many others. Certain supplies have already been delivered, while others will follow. In many cases, we are securing any available supply, including smaller quantity purchases, to ensure that we have what we need. Nous avons fait des progrès.
We have made considerable progress, but we know that the global demand for these products will continue to climb, and matters such as border restrictions around the world may affect the supply chain. As we have already seen, the situation will continue to evolve, and we will adapt to it accordingly.
PSPC will continue to work with industry to explore flexible and innovative procurement approaches in order to meet PHAC's requirements. As Minister Baines has just discussed, we are also looking at how to strengthen and secure our own stockpile and domestic supply of essential goods. In times of crisis, we all come together, and that is exactly what we are doing. Merci beaucoup. Thank you.
Thank you.
Okay, thank you very much, Anita. And we are now ready to answer your questions.
Okay, so one question, one follow-up. As agreed, we'll take 3 from the room and go to the phone. Julie, CBC.
Van Dusen, CBC. Mr. Blair or Ms. Freeland, with the border open to truckers and essential workers, what are you doing to make sure that as they go back and forth, they're not bringing the virus with them? What are the screening measures?
Actually, we have given advice to those truckers. First of all, they practice the recommended and appropriate hygiene measures and of washing their hands frequently and engaging in social distancing. We are also giving them advice on what to do should they become symptomatic, and they are routinely being checked as they cross the border to determine if they in fact are symptomatic. We are monitoring that situation very carefully, but we know the importance of the movement of that trade, and so we are facilitating essential workers crossing back and forth across the border, asking that they self-monitor for any symptoms which would be concerning, and then reference them immediately to health officials should they become symptomatic, and to practice the appropriate measures to make it far less likely that they would be exposed to the illness.
Okay. Now we're also hearing about Canadians heading back on airplanes who, I guess we thought they would be more rigorously screened before they got on flights, but we're hearing numerous examples of people that board flights to come back to Canada that aren't being screened. should we be worried about that, or is something going to change? I mean, this is what we're being told.
Let me be clear. It is the responsibility of the airlines, and frankly, they have a duty of care to all of their passengers, not to board people who are obviously symptomatic and possibly ill. And we are assured that work is happening. We are also asking them to make observations during flight, and should a person present as symptomatic, that information is conveyed to our agents on the ground. Those individuals would be met on the plane, immediately segregated from the other passengers on that plane, and then steps would be taken to those who may have been exposed to an exposed person. But I can assure you as well that when each and every person arrives in Canada from any place in the world now, they are screened to determine if they are symptomatic, and asked very specifically if they are experiencing symptoms, or if they have been in a region where the illness is particularly prevalent. And in every case, they're being asked. There's now signage up at every airport. The officers are asking the question. All returning passengers are required to fill out a form and indicate that they are not symptomatic and that they have been advised of the need to self-isolate for 14 days. We also have agents wandering in passenger processing areas, making observations of individuals, passing out public health information, and taking such observations as to screen in their own observations anyone who may be symptomatic. I will tell you the measures that have been put in place are very rigorous. I've heard from countless Canadians who have told me about their experiencing returning snowbirds, that when they cross the border, that they are being dealt with professionally, that they are being asked the questions that we have directed our agents to ask, and you know, the work is being done and is taking place.
Okay, Rachel, CTV.
From CTV here. My first question is for Minister Bains. How quickly can these companies get the equipment to hospitals and clinics so they can deal with the expected surge? Have you given these companies a timeline of when it needs to be out there?
So as soon as possible is a short answer. We recognize that this isn't the only measure we have in place. As my colleague Anita Anand mentioned, she's identifying the unique needs and the requirements, working in close consultation with the Public Health Agency of Canada, who are coordinating with their provincial and territorial counterparts to understand the needs, and these needs are evolving and changing rapidly, as you can fully appreciate. What I'm focused on is to say that we want to be over-prepared. We want to take all the additional measures that we possibly can, and one of the ways to do that is to build domestic capacity and mobilizing our industry to do so. So the letter of intents with these three companies that I highlighted today demonstrate that they're willing to scale in some cases, and also to start production as well. And in some cases, it's a matter of weeks and months. And these aren't the only companies. I can assure you, there's many companies that have expressed interest. That's why we're launching the website and that portal today to deal with other companies, so they can also provide us with information and their abilities to move forward, so we can assist them by scaling them up, by helping them start production if required. And what's important to note is we've also opened up all our industrial programming. The ones that I've highlighted today, the Strategic Innovation Fund, for example, the National Research Council, Innovative Solutions Canada, the super clusters, to make sure that they have access to all those resources as well. So we have the programming and the money in place. We have industry that's willing to step up. And this is going to complement the work done by Minister Anand, which is working very closely with the Minister of Health and our provincial and territorial counterparts.
And for Dr. Tam and Ministers Haidu, we're hearing obviously from the other ministers that there is no shortage right now of equipment or of tests. So are we going to be expanding the criteria of who can get a test? We've been hearing a lot of people who are showing symptoms but are still being refused access to a test. So how can we flatten the curve if we're not testing everybody?
I think, first of all, I want to thank the Minister of Procurement and the Minister of Innovation for their hard work on this. This is a massive piece of work to make sure that we're ready for surges that are coming and to continually replenish our ability to provide those services to provinces and territories. And the piece that Minister Bains is talking about is I think he's described it perfectly as the capacity to meet future anticipated needs. This is a global crisis. And so I'll remind people that the things we're searching for and we're purchasing, it's taking an enormous amount of effort and energy to get those items, because every other country in the world that is preparing like ours is trying to get those items too. So I think to the testing strategy, I think that is also evolving based on our own epidemiology, based on our own science and research, and based on our own capacity to access tests. So I'll turn it to Dr. Tam to speak a little bit about how what we're doing now in terms of our testing strategy and how we're perceiving that might evolve into the future.
Yes, I think we can appreciate a lot of people have various mild symptoms, and I think the key aspect of the strategy, which is done across Canada with provinces and territories and experts, is that first of all, asymptomatic people don't need to be tested. But of all the mildly symptomatic people, you have to be able to prioritize the really key individuals that must be tested. And these are sort of laid out in specific laboratory testing strategies. For example, if you have a symptomatic healthcare worker, and it doesn't matter whether they've traveled or not traveled, they have to be tested, because the first thing you need to avoid is this virus getting into high-risk settings. You have to prioritize any symptomatic persons living in long-term care facilities or nursing homes. You have to prioritize hospitalized patients no matter whether they've traveled or not. That's still a very, very key aspect, because that's where you're going to be able to detect if you got spread that is not related to travel, for instance. That is your biggest strategy to be able to find one of those cases. And certainly, as I indicated yesterday, people who are symptomatic, who live in certain communities that may have a more specific need for the test, such as people who are living in the north, or people who live in certain First Nations, Inuit or Métis communities, where you absolutely want to be certain that they're not being impacted by the virus, or that you need to contain it really, really fast. So public health, this is normal for public health. You don't just go and test everybody with everything. You have to be actually strategic about it, because you need public health nurses to investigate people as well. It's not just a matter of a test. Also, I think evolving is our actual public health measures. So if we're asking everybody to stay at home for 14 days, that is the actual public health action. Further laboratory testing does not result in a change in that strategy. You're still going to be staying put at home for 14 days regardless. But we are also reviewing the science of that strategy. So right now, for example, if you've got an onset of symptoms, there's international studies we're reviewing as to, well, when can that person go out if they didn't have a test, right? So those are the type of strategies that we're looking at right now.
And I just might add that as we proceed in Canada's epidemic, we're very closely doing two things at once, which is challenging, because the science is really not there yet. But one thing we're doing, obviously, is preparing our population for a potential surge and trying to flatten the curve. So the immediate actions. And the second thing is carefully reviewing the science and the evidence to figure out how we get out of this situation. And that isn't something that only Canada is doing. That is what the entire world is doing. This morning, in another interview, I explained that, social distancing is the best thing we have so far. But there is a ton of work happening with Canadian researchers and scientists, as well as international researchers and scientists, to figure out what strategy, whether it's testing, whether it's, I know many people are online reading about this right now, whether it's blood testing, whether it's a combination of social distancing and further analysis of people's, health situation, whether it's AI. We have our eye on how we get out of this situation. But the science is not clear yet. And as it evolves, we're certainly going to have more and more answers for Canadians.
Catherine Lévesque, en français.
Good afternoon. A question for Mr. Duclos or Ms. Breland. With what's being announced today for industry, Are we talking about a war effort? Well, the good news today is that there has been an excellent industrial policy and supply policy put in place, and that is being focused on prevention of coronavirus. The primary aim is to increase stocks of medical and protective equipment that we will likely need over the next few weeks to support provinces. The second advantage is to scale up industrial production capacity here at home. And the third is to ensure that the procurement capacity on the part of the federal government is firmly in place to help provinces and territories manage this crisis. And I would just like to point out that 3 businesses have signed an agreement with the Canadian government, and one of them is Medicom, located in Montreal. It is a recognized business for its production capacity for protective equipment and disinfectant, and also diagnostic tools and follow-up tools, monitoring tools for this disease. And so we are very grateful to these Canadian businesses that will be focusing all the industrial efforts of the Canadian government on this virus, and especially the efforts in Quebec and Montreal. I would just like to add 2 things, is that we are fortunate in Canada because we have a very strong manufacturing sector. That is a very important element in our national response, and I'm very proud of our scientists, our researchers, our business people who have really stepped up. They're really willing to work together in this national effort. And I would just like to say also that we spoke about this issue on Wednesday during my call with all the premiers, and all of them are very, very committed to this effort. It is really a Canada-wide effort. Thank you. I would just like to put my question again. Are we talking about a war effort? And another question, is there equipment that is a priority, for example, or industries being told to focus on masks, on ventilators? Answer, yes, it resembles a war effort because the Canadian government is focusing all of its production, its industrial production efforts and its supply efforts on fighting the virus. Now, that being said, the equipment that is going to be rolled out more quickly will follow the directives of the Public Health Agency, obviously in collaboration with the provinces and territories. There's a level of cooperation that is absolutely extraordinary between the federal government and the provinces and territories. And the good news is that with this scaled up focus on industrial production capacity, then provinces and territories will be able to take care of their own. Nav, would you like to add something? Yes, I agree with my colleague. It is so important to have a strategy across the sector, and that is why I am here today to announce this strategy. And it will help the healthcare sector. That is our priority. That's very clear, and that is why we're going to continue to work with all businesses across Canada, and we will amass the equipment that is necessary. I understand that this is a very serious and complicated situation right now, but a great many businesses want to participate. They want to step up. And that is why we announced this very clear strategy for all sectors, for all businesses, with a single goal to help the healthcare sector. Thank you. Telephone in French.
Thank you. Thank you. Merci. Please press star 1 if you have a question. S'il vous plaît, appuyez sur étoile 1 pour poser une question. The first question, la première question, is from Alex Bellinger from the Toronto Star. Please go ahead. La parole est à vous.
Not sure if we got
Please go ahead.
Oh, can you hear me? Can you hear me?
Yes, we can.
Okay. Yeah. Just going back to that question on what supplies we need. can you tell us, like based on what we have right now in this new industrial strategy, what products or what items are in most urgent need right now?
Nav, do you want to start?
Sure. Again, I just want to reiterate what I said before, which is this is to complement the work done by Anita and at procurement. And it's to say that we are taking every measure possible to be prepared, to make sure that we are over-prepared, as my colleague said, to understand very clearly the importance of taking advantage of our strong industrial base. There's many, many companies that have put up their hands, that have indicated that they want to be supportive, that want to retool their production facilities. And so we're identifying clearly the needs around masks and ventilators and gowns, hand sanitizers, etc. So what we're saying is we'd rather be in a position where we have the ability, because as my colleague Patty Haidu said, that there's global pressures, there's global demand, that we have the ability to quickly ramp up here in Canada. And again, that's designed with one clear purpose, to make sure that we protect Canadians and we protect frontline healthcare workers. That's what this strategy is about, is to complement and build on the work that is done by Procurement Canada, and it's based on the needs that have been put forward by the provinces and territories in conjunction with the Public Health Agency of Canada.
Okay, and I think Anita has something to add too.
Well, exactly, Nav. The most important point there is that these are complementary strategies. We are working together to ensure that we are leveraging our relationships with existing suppliers, and we're also working additional supply chains and developing new supply chains, because we know that this is an era of global demand and we want to be ready. We are anticipating future needs, and we are working very hard to ensure that Canadians are safe.
And just as a follow-up on that, I know there's been a lot of talk about ventilators. Can you guys tell us how many ventilators we actually have in all the provinces and territories, and how many additional ones have been ordered?
Actually, we can't give you that level of precision right now, but we can tell you that the provinces and territories are working very, very diligently to make sure that they have what they need and continually communicate with us what their current capacity is and what their current need might be based on any surge activity. This is a complicated question with a complicated answer. We actually have statistical and epidemiological modelers who are trying to figure out, based on the current expression of illness in our country, where we might anticipate surge, how we might be able to flatten that curve in that particular area, what additional measures we might take to flatten that curve. And so the question seems simple, but in fact, I would say it is not as simple as it sounds. Right now, we have what we need for the current situation based on the modeling as we go forward. There is also an agreement amongst provinces and territories of sharing supplies that are harder to produce or that are quite substantial, like ventilators, in a way that meets the surge depending on where it is in the country. So those conversations are what reaffirm for me that we are in a good position as a country to be able to meet those anticipated surges. Having said that, I know that Dr. Tam continues to work on this issue every day through her special advisory committee with the chief public health officers of the various provinces and territories. Do you want to add anything, Dr. Tam?
We have to get through questions. We're looking.
Well, actually, we're providing information. So Dr. Tam will...
Please let them answer. Thank you.
I think Dr. Tam would like... Do you want to add something, Dr. Tam?
Yes. I mean, right now, I know that we actually anticipated there would be a need for more ventilators. So we went ahead without necessarily province territories telling us what they need right now. So we, as an anticipatory measure, we placed an order for 550 ventilators. That might change, that might evolve, and we're trying to get secure contracts as we speak. That's without waiting for the specific numbers that provinces are currently needing right now, but that's just as a preemptive. I just have to say that we do have what we call a mutual aid agreement between provinces and territories. We have something called the operational framework for mutual aid. So if certain areas of the country are impacted more than others, you don't just need the ventilators, you might need the people that operate them. So there are mechanisms that exist should that be needed.
Okay, Nav does have something to add.
Yeah, just very quickly to build on what Dr. Tam said, and again, to build on the work by Anita Anand and our procurement team, one of the companies that we identified today, Thornhill Medical, is actually in the business of building ventilators, and they have the ability to scale up. And we're trying to identify companies like this that have the ability to scale up on a going forward basis to deal with future needs as described by my colleagues. So it really is, as mentioned before, a strategy that speaks to strong procurement practices based on the current needs and potential future needs, and also starting to build up our industrial capacity. And that's what we're announcing today. This situation is very fluid. The numbers will evolve and change, but we are doing everything we possibly can to make sure we have more, not less.
Thank you. The next question, la question suivante, est de Nina Dib de la Presse canadienne. Please go ahead. La parole est à vous.
Oui, bonjour, Monsieur Duclos. La première
Good
question
afternoon,
est pour
Mr.
vous.
Duclos. The first question is for you. Can you confirm what Minister Blair said, that the closing of Roxham Road is for migrants is only temporary and will go back to business as usual once the border has reopened? And you also said that you are taking responsibility for the migrants. Can you tell us how many people are already in Canada who have been taken into custody by Ottawa, and where are they? Thank you. I'm just going to sum up the announcement of Minister Blair. I'd like to thank him once again for his hard work on this issue. And so, since this morning, a reciprocal arrangement has been reached with the U.S. government, which means that asylum seekers who come through irregular points of entry are redirected back to the United States, and that will be effective tonight at midnight, just like the other measures that we announced earlier this week regarding the travel of passengers across the border for non-essential travel. That being said, we have also announced earlier this week that this is a crisis, so it was no time to discuss jurisdictional matters. This response to this crisis calls for extraordinary measures, and that is why the federal government is assuming responsibility for isolating all asylum seekers who have come through irregular channels and who have not respected the 14 days of isolation, and that is what we have announced today. And I'd just like to add a small detail from the Deputy Prime Minister. Minister Blair helped us with the very specific details on this, and concerning the announcement that Minister Mendicino made yesterday, the federal government has taken responsibility for finding a place for asylum seekers to be placed in isolation. And so Canada has taken responsibility for that, for finding a place for them. Thank you, and thank you, Bill.
Une dernière question au téléphone?
Last question on the telephone?
No. Okay. Kelsey Johnson, Reuters, maybe?
Thank you. My first question is to Mr. Blair and Dr. Tam. I'm wondering on the migrant worker, on the refusal to, or sorry, not migrant worker, on the refusal to allow irregular asylum seekers into Canada. What changed, and what evidence is there to suggest that this population is a higher health risk?
There is no evidence that they are a higher health risk, but we have recognized that non-essential travelers coming across the border do represent a risk, and we've taken steps. We've put in place right across the entire Canadian border to restrict non-essential travelers coming in. We also recognize the importance of ensuring that if people do come across that border, they are subject to a period of 14 days self-isolation. Accommodating and managing that is a difficult challenge, and we've been working very closely with the Quebec government on this issue, who normally accommodates these. And as a result, as part of a large group of initiatives and measures that we have put in place with our allies in the United States, we have agreed reciprocally that in both directions, irregular migration will be curtailed, and for any individual coming across the border at a regular point of entry will be directed back to their country, the country from which they originated. So coming from Canada into the United States or from the United States into Canada will simply direct them back to curtail that irregular migration, which is very difficult, quite frankly, to monitor to ensure the safety of Canadians. It's part of a larger suite of measures that we are putting in place to have better control of non-essential passage of that border. And this is a challenge that to manage and regulate. And so to address that challenge in these extraordinary circumstances, we've agreed that this is the appropriate measure to put in place.
Okay, and my second question is also to Dr. Tam and to Minister Freeland. Should Canadian athletes travel to Japan for the Olympics, even if the Olympics go ahead?
Dr. Tam, do you want to start?
I think our recommendation is to avoid all non-essential travel.
And we believe in following the advice of our experts here in Canada. And so let me just echo Dr. Tam and say Canadians should avoid all non-essential travel. We've been very clear about that, and that is for the health of the potential travelers and for the health of all Canadians when you come back home.
And I would also just add, given the global situation and how quickly things evolve, we can see that there is disruption in air travel, there is disruption in terms of border measures, and so it is very hard to predict what is going to happen right now globally from a variety of different perspectives. And the safest thing for Canadians is to do right now in terms of international travel is to stay home.
Okay, we're going to go back on the phone.
Question is from Lauren Gardner. La question suivante est de Lauren Gardner.
Next question from Lauren Gardner, Politico.
Thanks for taking my question. So there's no specific mention in the U.S. guidance on the partial border closure about things like compassionate travel, which has been a term that's been thrown around a couple of times in the last few days. And there are some specific examples of who's allowed to cross for work, but that leaves some question as to how much will this be left to border agents' discretion in order to determine whether someone's business reason is actually quote-unquote essential.
Yeah, I'll begin the answer to that question. You know, our officials on both sides of the border are working very closely to make sure that there is a consistency in the way in which these measures will be implemented. But at the same time, we recognize that there are exceptional and extraordinary circumstances, and there is an expectation that border officers will exercise the appropriate discretion in determining in those exceptional and extraordinary circumstances if that the travel is in fact essential. What we are all united in attempting to do is to discourage that travel which is clearly not essential. The people that are engaged in tourist activities or recreational activities. We recognize the importance of workers getting to their important jobs. We recognize the importance of ensuring that we maintain the supply and goods that comprise the vital trade and supply chains that cross our borders each and every day. And at the same time, we recognize that there will be extraordinary circumstances, and so our expectation is that extraordinary matters will be dealt with in extraordinary ways.
Yeah, and I would even add, you know, to maybe use a trade metaphor, this is about a negative list approach rather than a positive list approach. So we actually have made a real point in saying, actually, what we are restricting is non-essential travel, and we specified for tourist or recreational purposes. And that's clear and specific because we understand that the Canada-U.S. border relationship is so deep, so interconnected. There are communities like Campobello in Canada, like Point Roberts in the United States, for whom daily life does require crossing the border, and for whom crossing the border is as much a part of what they do every day as what those of us who don't live in one of those communities is. It's literally going to the grocery store. It is literally for the fire department to function, the local fire department. People have to go back and forth across the border. So I really want to be clear that, and this is the understanding, we had very clear conversations starting with the President and the Prime Minister, me and the Vice President. I spoke to Secretary Pompeo, and Bill has been talking to the Homeland Security Secretary a lot over the past few days. Both our countries really understand how important that border and that border relationship is, above all for trade, and trade which is essential for our communities to actually survive, particularly in this period. People have been talking about making sure our grocery stores have food, making sure that medical supplies can go back and forth across the border. But even beyond the trading relationship, there are a lot of people whose lives really require going back and forth across the border, and that will not be impeded. What we are doing is saying there are some activities which are clearly non-essential. If you are American, we love American tourists, but now is not the time to go to Whistler. If you are Canadian, now is not the time to... Hang on. No,
Sir, please.
but excuse me, this is actually a really important issue that a lot of Canadians, especially those who live along the border, really care about. And we've had a question saying that people are not entirely clear. So I'm going to finish my sentence, okay? So, non-essential travel is restricted, and that is it.
And a quick follow-up is, there's feedback. Is there any interest among the cabinet in seeing what's now a temporary move on turning back irregular migrants? Is there any interest in seeing that made permanent in the future once this pandemic is behind us?
And I'll begin in the answer to that. We are dealing with extraordinary circumstances today, and our focus is entirely on keeping Canadians safe, and we have taken and will continue to take the necessary measures to effect that purpose of keeping people safe. We have taken what we believe to be a responsible measure in a reciprocal way with our allies in the United States. Both of us share a concern for the safety of our citizens, and that's where our focus is today. And we will managing the asylum issue has and will continue to be an important issue. But the measures we put in place today are very clearly and laser-like focused on the need to keep people safe, and that's why we're doing it.
Okay, one more for the phone.
Thank you. The next question, la question suivante est de Marie Vastel de Le Devoir.
Marie Vastel, Le Devoir. Please go ahead.
Oui, bonjour, Mr. Blair. Can you hear me?
Good afternoon, Mr. Blair.
Hello?
Yes, he can.
I can. I didn't turn my microphone on, Maria. I apologize.
Okay, it's because I didn't unmute my phone when I was asking a question of the Prime Minister, so I wasn't sure. I was wanting to ask you a little bit more about the migrants change that you guys are bringing forward today. You mentioned that there would be limited exceptions to the ones that would be turned back at the border. I'd like to know what those are. And I'd like you to elaborate on why you're deciding this now, given that yesterday you were still planning to put them in isolation in Canada. I'm wondering what changed. And I guess I'll get a follow-up after. Thanks.
There are some very limited exceptions, and for example, an unaccompanied minor with an American nationality, for example, would be an exception, and who is claiming asylum from the United States, and so we acknowledge that those limited exceptions exist, and we are prepared to deal appropriately with them. But at the same time, I believe that the measures that we have announced today will be effective in deterring people from coming. I think there's a growing acknowledgement acknowledgement. I'll tell you, for example, yesterday, we have averaged about 45 to 50 people coming each day. Yesterday, the number was 17. And so I think people are recognizing that this is not the time to be going to the border and crossing over and engaging in that behavior, because it presents a risk to them and to others. And so we believe that these measures will be effective. And if you ask, why it took so long, quite frankly, this was an extraordinarily rapid discussion that took place between our government. And as the Deputy Prime Minister has indicated, there have been very important but incredibly collaborative discussions taking place at a number of different levels within our government. And I would take the opportunity, if I may, to acknowledge the extraordinary work of our officials who have been working through the details and the important parts of implementation that have made this effective. But there has been an extraordinary collaboration between our two countries, and it is important to recognize many people just say, well, why don't you just do this and act unilaterally and just put it in place. And I think that demonstrates a profound lack of understanding of how things work between two sovereign nations. It is important that we discuss these things. It is important that we work together, and we've done that. And I will tell you, the level of collaboration and the speed with which this has been achieved is unprecedented. And frankly, only a week ago, I would have suggested was inconceivable. And yet it's been done. The work happened, and we've come to this, and it's the right thing to do, and we're moving as quickly as possible because we're all motivated to keep people safe.
Yeah, actually, my question wasn't why it took so long. My question was why now, given that for years now your government has refused to turn back people at the border despite multiple calls from the opposition or from other groups. So I'm wondering why all of a sudden you do feel comfortable and that it's the right decision to turn these people back. And then my follow-up was concerning temporary residents in Canada. We were told by Minister Garneau a few days ago that people with work permits or student permits would be allowed to come back to Canada despite the closing of the border, but they are not being allowed to come in, for example, at the Trudeau Airport in Montreal. So can you say when you expect some clarity on the fact that people should be able to come in, but they are being refused despite being allowed to be coming in?
And again, Marie, judgment is being exercised on the essential nature of that travel. And quite frankly, we are doing our very best to discourage all non-essential travel internationally and across the transborder with the United States. And so, again, discretion and judgment is being exercised in those cases. We wanted to assure those people who, for example, were already here on student visas, for example, would be assured that they would be able to continue to do that. At the same time, we also recognize in some of those circumstances with student visas, certainly with work visas, and absolutely for temporary foreign workers, we recognize the essential nature of that work. And so in respect of the essential nature of that work, it will be, of course, exempted from the restrictions that we have put in place.
Yeah, and let me just add some further clarity there. What Minister Garneau said earlier this week is the case that valid work and student visas to come to Canada will be respected at the Canadian border, at the Canada-U.S. border, and at international borders, and that includes temporary foreign workers. Those people, of course, will need to self-isolate for 14 days, like everyone coming back to Canada. As for the uncertainty at the border around the rules, I think all of us need to have a little bit of patience and understanding about the current situation. These are extraordinary times. Our government, across the whole of government, is acting at a pace which would be neither possible nor advisable in ordinary times. We're doing things that would normally take 3 to 6 months in 2 or 3 days. And that is absolutely right because the situation demands it. But what it does mean is that very often today we're in a situation where we need to make an announcement and make clear to Canadians what we are going to do and fill in the details afterwards. And what that does mean is the people whose job it is to implement when it comes to the details, it takes a little bit of time for the precise information to get to everyone. And, you know, in ordinary times, that is not how we would operate. But I think that I am very confident that that's what we need to do today. And I'm actually really confident that Canadians are smart and they understand, you know, as Dr. Tam said to us, I think it was on Tuesday, St. Patrick's Day, right? Choose speed over perfection. That has become a real motto for us because we understand this is a global pandemic. And so we need to act with agility and alacrity, and we are. And I would like to apologize to all Canadians that it does mean that sometimes every single detail, and not sometimes, it means pretty much always, every single detail is not going to be worked out in advance. But I think people will agree, better to act with speed than to wait for the perfection, which could mean that our country's response to this global pandemic would be delayed with truly fatal consequences.
Okay, we've gone over quite a bit, so we'll take one more question from the room. Mike from Global, and then one last question on the phone.
Okay. And there's new assessment centers that are going to be opening up, sorry, in Canada. Can you tell me what these are for? Are they going to be frontline places where people go, or? There we go.
I assume, are you talking?
Or is it frontline places are going to be handling overflow for cases like hospitals can't handle it, or okay. What is the role of these assessment centers?
I'll let you take that.
Yeah, of course, that's in the purview of the local and provincial jurisdictions, but for the most part, these are specifically set up to assess people with potentially have COVID-19.
And the other question is, so I've heard that it takes we have a backlog on testing. So you get the test, it takes about 4 days to get results. If that's the case, we're waiting for people to get symptomatic, they get the test, and then they have to wait 4 days till they get the results back. At that point, what is the point of the testing? Because we would know in 4 days whether someone is sick or not.
Well, the point of the testing is to confirm whether or not they have COVID-19 and do the contact tracing. So first of all, let me just say on the testing time, it varies from province to province depending on whether or not they're close. Go ahead. Do you have an average?
Well, I can talk to our lab, but you know, obviously there's different laboratories, which is well, our lab is a very special one where someone may have to ship it to us first, but it's like a day on average. But there's all sorts of other reasons why some things might not reach us within that kind of time frame. But as soon as we get it, it will be like a day. But there's transportation at other times. But I think the most important thing is that people must self-isolate immediately. That's the key.
And I think just to your question, that's the most important part. Whenever anyone is symptomatic, they should be self-isolating at home. And that is the important part. So the test doesn't clear them or not. It's not about actually a clear at this point. It's about, you know, trying to confirm if they have it and then allowing public health to do that hard work of the contact tracing. Who have they been near? Did they actually, you know, were they exposed to somebody else? How did that case come about? And that's how you work on the containment piece. That's how you make sure that you can contain the spread within that particular community or within that particular setting. And all of that data folds up into the provincial data, which then lands in the federal database, which allows us to understand the modeling so much better about where we're seeing potential sparks. If you remember those early conversations about the sparks coming from China, now we're trying to do the same thing in Canada. We're trying to figure out where is the fire burning and where are those sparks going so that we can actually better contain and hopefully defeat the spread across the country.
Thank you, Minister. One last question on the phone.
Thank you. The next question, la question suivante est de Louis Blouin de Radio-Canada.
Louis Blouin, Radio-Canada, please go ahead. Good afternoon. I have a question concerning the asylum seekers who are crossing at irregular points of entry for Minister Duclos. What happens to asylum seekers who are returned to the same U.S. authorities? Will they be detained? Will they be released? What is their lot? Thank you.
I will attempt to answer this first in English, and then I will turn to my friend to answer in French, if I may. Under the overwhelming majority of circumstances, they will not be detained. They'll simply be returned back to the United States, or, for example, if they come from Canada and are returned to us, they would not be detained. There are very, very limited exceptions, and for example, if there was an issue of serious criminality that had to be addressed, then that might result in a person's detention. But just as it relates to the border and immigration matters, and there would be no detention.
So in the vast majority of cases, people simply return to the United States if they're coming from Canada and vice versa because of this reciprocal arrangement. And in very, very rare exceptions, for example, violence or serious criminality, they could be detained, but those should be very, very rare cases. Thank you. Question. Are there patrols being put in place to ensure that people are not trying to cross elsewhere than Roxham Road? Are they patrolling in other places across the border to ensure that the border is sealed? Answer, this is a reciprocal arrangement. So no asylum seeker should be crossing at irregular points of entry in either direction, and therefore both of our governments are applying the required measures. Thank you.
Merci beaucoup tout le monde.
Okay, that is a few cabinet ministers and Canada's chief public health officer answering questions about a variety of important measures that the government announced today. And we'll try and just break down the things you need to know before we let you go. And for some help on that, I'll bring in David Cochrane. And David, you want to talk about the procurement piece of this as Canada tries to secure a certain supply of medical equipment and then find ways to produce it here in this country.
Yeah, there's obviously an urgent need in hospitals and in health systems on the front line to have medical supplies, and we've seen today the system that Canada is going to follow to deal with this. Patty Hajdu and Theresa Tam are going to identify the need in conjunction with the provinces. Anita Anand, the procurement minister, is going to buy what's available, and Navdeep Bains, the industry minister, is going to help the Canadian industrial sector ramp up and retool to create a domestic supply. So some numbers today. Dr. Tam telling us they preemptively ordered 550 ventilators on top of what they've already stockpiled and on top of what the provinces already have, and they're working to get more. Anita Anand saying that they've secured 11.3 million N95 masks. The provinces had said they need 7 million. They've got 11 million. So she said their goal is to be over-prepared. And Navdeep Bains announcing that they're taking all these industrial and innovation funds that exist in the country and focusing them on the fight for COVID-19 and securing contracts with 3 companies, one in Montreal to start manufacturing personal protective equipment like N95 masks, one in Ottawa for a small-scale portable diagnostic device that can do tests portably, maybe in airports, and get results within 30 minutes, and a company called Thornhill Medical that makes ventilators. They're going to scale up and start producing more ventilators, and also auto parts manufacturers. I think when we were looking at the auto sector to help build medical equipment, people were looking at the big car plants. We're looking at the wrong part of that supply chain. It's the smaller scale manufacturers that supply things that are going to retool to help do this. In addition to, as Minister Anand said, 5,800 submissions from other companies looking to scale up and adapt what they do in a way to supply necessary medical equipment into the healthcare system. So this shows the urgent need and requirement and the anticipated long-term need and requirement, Rosie, because ramping up a new production line is not something that happens overnight. So the short-term needs, Anita Anand is on that. The long-term needs, Navdeep Bains is on that in conjunction with the Health Minister and the Public Health Agency of Canada, because the reality is, Rosie, the global supply chain is going to tighten, if not dry up. We've already seen the European Union has put restrictions on the export of core medical equipment. We've seen Thailand do that. It's only a matter of time probably before you see something like the United States do something like that. So to keep the country whole, the country needs to mobilize entirely in this direction, and that is what you're seeing, a wartime footing in a lot of ways to beat this viral enemy from Canada's industrial capacity to put the supplies into the frontline health services that are so badly needed.
Okay, good job breaking down the way they presented that. Let me just highlight a couple of other things that came out of that press conference. A reminder to Canadians that the border closes for all non-essential travel as of 11:59 tonight. That will now happen at the Canada-U.S. border and the Mexico-U.S. border. And the government announcing today that they are also, those crossing at irregular points of entry, like Roxham Road in Quebec, will now be directed back to the United States. That also a significant shift in government policy that they say is temporary. All of these temporary border closures will be reviewed after 30 days to see if they need to be extended. A couple other points I want to leave you with. Dr. Theresa Tam said that there have been to date 66,000 tests in this country, 10,000 yesterday alone. So we are seeing more testing, although she gave a very good explanation as to why not everyone is getting tested. We know that the first plane repatriating some Canadians from Morocco will return this weekend, and the government is looking at Morocco and Peru as two areas of focus. If you know a Canadian who is stranded in one of those countries, government also looking at school groups who may be stuck in countries overseas. And finally, let me leave you with a staggering number the Prime Minister gave us this morning around those of you who have already looked for some financial aid, employment insurance, or other things from the government. The Prime Minister telling Canadians that 500,000 requests have already gone in to Service Canada. That is an extraordinary large number, and we will expect it to go up in the days and weeks ahead as the economy struggles with this public health crisis. I want to thank Vashi Kapelas, who will be on Power and Politics later, David Cochran, who will be on The National later. I'm Rosemary Barton. We will bring you these specials and the special coverage throughout the weekend as they happen, but for now, you can watch ongoing coverage here on CBC News Network. Thanks for watching.